Good morning. My name is Nina Martinez. I'm the board chair of Latino Civic Alliance. Thank you so much for joining us for the 2022 Virtual Latino Legislative Day. Latino Civic Alliance is a statewide advocacy and civic engagement organization with a supportive base of over 10,000 in the state of Washington. If you want to invite others to join us today that may not have registered, they can always visit our website at www.latinocivicalliance.org, and it will be shown live this morning, or for the day from 10 a.m. to 2 o'clock this afternoon. And we'll be shown live again. I want to thank our consultants, Ann Larson and Jennifer Hansen with Event.org LLC for working with LCA to organize this important virtual event. We are showing the interpreter.
Bienvenidos. Para las personas que hablan en español, queremos decirles que ustedes pueden utilizar el servicio de español utilizando la interpretación. Si ustedes se dan cuenta, tienen en su screen van a encontrar este botoncito, el cual pueden espichar, presionar y pueden marcar si quieren español o en inglés. No se preocupen, después de que lo han presionado, pueden escuchar a todo. Ok, gracias.
Thank you, Claudia. The history of Latino Legislative Day since 2005. Latino Civic Alliance LCA is a statewide advocacy and civic engagement organization with a base of 10,000. Its mission is to advocate and protect Latino civil rights in Washington state. Since the organization's formation in 2005, LCA hosts Latino Legislative Day every year during the legislative session. It is a time when Latino leaders and organizations serving Latinos across the state will unite to meet with legislators, the governor, and state agency leaders and talk about the issues that are important to them. We have had to host Latino Legislative Day virtually the last 2 years since COVID pandemic, but we normally have over 2,000 Latinos that come in person to Olympia. But we're grateful that we're able to host a Latino Legislative Day virtually this year. Why Latinos make Washington stronger? Latinos have built the state economy with its strong workforce and small businesses. According to the Washington State Office of Financial Management population estimates, the Hispanic Latino population is increasing steadily in Washington, almost doubling during the 1990s and reaching 13.4% of population by 2020. In 2020, Washington ranked 13th highest among the states in total Hispanic Latino population and 15th in the percent share of Hispanic Latino population. It's obvious that we are growing tremendously. Latino small businesses are seeing impressive growth in Washington state. The economic growth is much higher than average in Washington. The economic boom is doubling at a rate faster than the national average in Washington. Next is Latinos voting power. With the 2020 census estimating Hispanic Latinos are over 1 million in our state, we have the power to organize and significant impact policies that are created in Olympia and locally. There is strong coordination as today to register new voters aging from the ages of 18 to 24. The highest percentage of Hispanic residents are found in Central Washington, Adams County at 69%, Franklin County at 55%, and Yakima at 51%. Counties posting the highest shares. Tremendous growth. I would like to share with you today about our agenda. We have a great event planned today. We have an overview of healthcare, COVID, Omicron, and variants. We have a community perspective that will be sharing the challenges that organizations are experiencing today during the pandemic and the hard work that organizations are trying to address and help. Mental health, the opiate and fentanyl abuse is extremely high in Washington state. We'll have an expert talk about that. Immigration, an update on DACA, small businesses, education, social emotional learning program that LCA has under its organization, and we have a great presenter on that. And then we're going to host our special event that starts at 11:55, and we'll have some great speakers, and we're going to also host the 2022 Latino Civic Awards, honoring Dulce Gutierrez of Yakima and Pedro Espinosa of Seattle. We'll have Governor Inslee speak and address The audience will also have keynote speaker Rebecca Saldana, extremely excited that she'll be joining us today. The Advocacy Day continues this afternoon with presentations starting at 12:30. We will hear from the Washington Coalition for Police Accountability, hearing from a mother, Marilyn Covarrubias. She is a mother of Daniel Covarrubias, and Sonia Joseph, mother of Gideon Joseph McKay, that they lost their sons to police shootings. We'll hear from the Attorney General today, and we'll also have an important educational session about the Latino civil rights history in Washington, presented by Dr. Gilberto Garcia, professor of Central Washington University. I would like to close with Latino Civic Alliance's announcing the opening of the new Latino Civic Center downtown Burien. It will showcase Washington State civil rights history, civic engagement, civic education in a recording studio. And I want to acknowledge the powerful and outstanding commission painting by artist Maribel Galvan. I hope you can see her beautiful painting. And also want to thank our sponsors. Our gold sponsors today are Pacific Northwest Regional Council of Carpenters, Seymour Community Health Centers, Group Health Foundation, Evergreen Business Capital, Catholic Community Services, Lembecker Law, and more. And I especially want to recognize our community partners that are subject experts that have volunteered their time to join us for Latino Legislative Day for the presentations. Thank you. Well, last I want to acknowledge something. There was another screen that I wanted to jump in and say. I wanted to acknowledge that our hearts go out to community members that we've lost to COVID pandemic. I want everyone listening today to know that LCA and our partners have continued to advocate for improved state outreach funding for vaccination sites and protective supplies. We will not stop fighting for our communities to be better served. So thank you. Again, thank you for joining us for Latino Legislative Day.
So we're going to move now to our first presentation of the day. This presentation will be specific on COVID-19 pandemic, the Alpha, Delta, and Omicron variants, the ongoing disparities in COVID-19 impacts on the health and well-being of Latino communities in Washington State. For the presentation, we had a great presenter this morning, Leo Morales. Leo is a professor, an assistant dean of the Health Equity and Quality in the School of Medicine and co-director of the Latino Center for Health at the University of Washington. Dr. Morales received his medical degree, a master's degree in public health from the University of Washington, and his doctorate in policy analysis from Rand Graduate School. He completed a residency in primary care internal medicine at the San Francisco General Hospital, UCSF, and a fellowship in primary care research at the UCLA. Dr. Morales' research focuses on Latino health, racial, ethnic, and socioeconomic disparities in health, and the measurement of patient-reported outcomes in diverse community. Please help me to welcome Dr. Leo Morales. Thank you.
Thank you so much, Claudia. I'd like to share my screen now. Does that look okay, Claudia? Okay, thank you. Well, first, I just want to thank the Latino Legislative Day organizers for inviting me to be here today, and in particular, the Latino Civic Alliance. I want to say what an honor it is to be invited to present today. As a son of immigrant parents and someone who was born, raised, and educated here in Washington, this is really a tremendous honor. So as mentioned, my name is Leo Morales, and I have no disclosures to share. I want to say a little bit about our center, the Latino Center for Health. We are a state-funded multidisciplinary center, and our mission really is to promote the health of communities in Washington State, Latino communities in Washington State, through community-engaged research. So where are we today with the COVID pandemic? I think we all are aware that we've been through several different surges, including Alpha, Delta, and now Omicron. On the left here, you can see the proportion of variant that has been in each of these surges. I think what's worth noting here is how large this Omicron variant surge has been relative to Delta, which we thought was large, and Alpha, which happened very early on, was the first real wave of the pandemic. These are data from the IHME Center at the University of Washington. At the top, you can see those surges in daily infections, and in the bottom, you can see deaths due to each of these different variants. What's notable here is that although the Omicron surge has been so much larger than the previous ones in terms of infections, the mortality, although still unacceptably high, has not been proportionally as high. And that's due to multiple factors. But we're thankful for that it has not had the impact that it may have had otherwise. But the pandemic has not been experienced similarly by all groups in our state. And so it's important to disaggregate these curves into different population groups in particular. We can look and see how this pandemic has had disproportionate impacts on communities of color, in particular, Native Hawaiians and other Pacific Islanders, Latinos or Hispanics, African Americans and Blacks, and American Indians and Alaska Natives. So although we often are just looking at the general curve, we need to understand that this has not been a shared experience in many respects. Just recently, there was an article in the New York Times citing the fact that Franklin County, one of the counties with the highest proportion of Latinos in our state, had the second highest rate of COVID infection in the nation. And so you can see down below here, the different counties that are among the highest, have the highest infection rates, and the proportion of Latinos in each of those counties. So for example, as a reference point, the state has 169 per 100,000 as the infection rate. And in Franklin County, which is 56% Latino, it's 410. And we can look down these different counties and see how this impact is occurring in Eastern Washington right now. These statistics are reflected in infection rates in our state. As of recently, we can see that 20% of infections, COVID-19 infections in our state have been among Latinos, although they represent only 13% of the population. Contrast that with non-Hispanic whites, who have accounted for 61% of infections in our state, but represent 68% of the population. The same is true for other groups, that this has been an unequal experience in terms of the proportion who are infected. I think it's also important to understand that this has not just been an experience of infection. It is also impacted and has led to disparities in death rates. So these are age-adjusted death rates of due to COVID per 100,000 in our state. And you can see here, relative to the non-Hispanic white rate of 120 per 100,000, Latinos have had a mortality rate due to COVID of 314, or 2.6 times as large. This should be quite disturbing because there's no reason that different groups should be having different experiences with the COVID virus. The virus itself does not treat people differently. It's the conditions and experiences of those individuals and many other social and economic factors which we can impact that make this difference. So why the disproportionate impacts? Here are some of the proximal explanations. And by what I mean by proximal is this isn't taking into account the upstream explanations that set the conditions for why this occurs. But here they are. So crowded living conditions. Crowded living conditions lead to communication of the virus. Multi-generational households, so that vulnerable groups, older individuals and very young individuals are infected by those who might bring the virus to the household. Occupational exposures, so individuals who cannot work from home and who are forced or need to work in situations where they might be exposed without protection. There's also a great deal of undiagnosed and untreated chronic conditions among Latinos, including diabetes, cardiovascular disease, and kidney disease. These predispose to poor outcomes and mortality. There's the issue of access to care, whether or not people are insured, the costs they face in seeking care, whether or not they have access to a usual source of care, delays they take in care, either for reasons of not knowing how to access care or concerns around cost or other concerns, and the rise of telehealth and other virtual care, which has not provided equal access for all groups. The issue of trust, which is really seated in history, and how that opens the door for misinformation. Lack of vaccine access, and of course, those concerns that are raised by misinformation leading to hesitancy. And I think fundamentally, the lack of culturally and linguistically concordant healthcare workforce, doctors and others, healthcare providers, nurses, individuals in the community who can help the community navigate the healthcare system. If we look at vaccination rates, obviously what prevents serious infection, we can see that among Latinos, they lag the rest of the state in terms of coverage. And this is recent data among those who are 5 years and older. And so you can see either if you're looking at fully vaccinated or partially vaccinated relative to the representation in the state, they lag. But we can also look at an estimate of the population covered. And here I call your attention to the small call out box here. So there are approximately 1,022,677 Latinos in the state, 51% of whom are vaccinated. Among those who are 5 and older, that's about 57% because we exclude the younger. And of those 0 to 4, none are. We don't have much information about vaccination rates among children, the newest group to be entered into eligibility for vaccines. But we can see here from the Pulse data, which is a survey conducted by the US Census, and this is for December 29th through January 10th, 2022, that about 53% of families with children 5 to 17 are reporting vaccination coverage. And among the unvaccinated, we can see that there are 41% who say they will definitely not get vaccinated. On the other hand, 24% definitely yes, 7% probably, and 25% who are unsure. Diabetes as an underlying chronic condition that predisposes to poor outcomes is disproportionately represented among Latinos. So this is national data showing that 13%, almost 14% of Latinos have diagnosed diabetes, but 4% have undiagnosed diabetes. So this is population-based data for a total of 18% having diabetes. This doesn't speak to treatment or well-controlled diabetes, which is necessary to prevent those poor outcomes. And in Washington state, we can also see data that shows the high rate of diabetes among Latinos represented in this blue line. Residential crowding is something I mentioned, and we don't have a lot of data for the state, but we do have some national data. This is data drawn from the US Census, the 2000 census. And these are rates of residential housing measured by persons per room. 1.5, greater than 1.5 persons per room is considered crowded. And here you can see the difference between non-Hispanic white, all Hispanics, Mexican Americans, and Central Americans in the United States. So you can see how much higher this crowding issue is. And this is more recent data from 2005 showing the change between 1985 and 2005 in crowded housing situation for all Latinos in the United States and how much that has increased. So the trend at baseline, we see high rates and we see a trend of increasing crowding, which sets up this perfect storm for COVID once it arrived. And certainly social determinants of health, such as food security, financial security, and access to care through insurance, which is basic, But you can see how much higher, this is for Washington State, again, based on the household pulse survey by the US Census, estimating that 20% of Hispanics in our state are uninsured at the current time, that 13.5% experience food insecurity, and that 35% are experiencing financial insecurity. I think it's important to understand the role of testing. So we have been faced with the need for urgent testing, and we can see from data from our own county here in King County, where Latinos reside, where testing is occurring in North Seattle, and where the highest rates of COVID are occurring in South Seattle. This disconnect is what leads to poor outcomes. And another way of seeing this is socioeconomic risk associated with tests and positivity rates. Again, the disconnect, where the tests are occurring and where there is higher rates. And similarly with hospitalizations and deaths. Why is this important? Because in order to have access to new therapies, which are potentially life-saving, it is important to have early access to testing, access to healthcare to get referred for this treatment, and then timely access to these monoclonal and antiviral treatments, which really have to occur within the first 5 days of symptomatic infection. In summary, here are the impacts on Latinos. There's been a disproportionate rate of infection, leading to disproportionate rate of hospitalization and disproportionate mortality. Each of these links has a story that's related to disparities and inequities. There's lagging vaccinations, boosters, and youth vaccinations in our state among Latino youth. There's inequitable access to testing, both PCR and rapid antigen testing. You know, it's just been a shame that we've had rapid antigen testing and other forms of rapid testing since nearly the beginning of this pandemic, and yet we were unable to get this into the community when Omicron hit. It would have been so important just prior to the holidays, and with the release of these new therapeutics for every community member to have access to these tests. Because of that and other factors, there's inequitable access to these new treatments. And underlying all this are ongoing economic, social, and educational inequities. And finally, there's a shortage of culturally and linguistic concordant healthcare providers, which poses barriers for Latinos seeking care. If you want to learn more about these issues, please visit our website. We have a series of policy briefs addressing many areas that are covered here. With this, I'd like to end and thank you for your attention, and I'm happy to entertain any questions or discussion if there's time.
Thank you. Thank you very much, Dr. Morales. Wonder if I'm looking at the question and answers. I don't see any questions in there. Anybody posting questions? Is there any questions from anybody? Don't see any. I have a question. Wonder what type of, are you familiar with any type of education activities that are targeting specifically the Latino community in terms of COVID-19? Are you aware of any specific target education activities?
So there's been many different, I've been involved with and I'm aware of many different efforts to do outreach throughout the state. I think the most effective are very much embedded in the community, often with promotoras, working directly in the community, talking to people about getting vaccinated, talking to people about how to access these tests, how to use these tests. We've been big supporters of partnership with community-based organizations because we understand that only so much of the population has access to healthcare. So for individuals who are not connected to healthcare systems, we have to work with community-based organizations that are. So I think there are many efforts, and I know through the Latino Civic Alliance and others represented here today who will speak after me, they will talk about the many efforts that have been made to do community outreach. But as we can see, there's much more to do, and we need to continue this work. This epidemic, although some are saying is over, is far from over, and its impacts are going to be long lasting, which we have yet to really understand and even begin to address.
Thank you. I believe we have a raised hand, somebody by name Lopez.
Yes, can you hear me?
Yes, I hear you.
Yeah, so as I was listening to a lot of data that you were mentioning, one thing that came to mind here, state of Washington, our agriculture, our farm workers. I didn't hear anything related to those numbers. So I don't know if there's data, in the agriculture, how it affected the farm workers, and is that data unreported, or I just wanted to see what or related to the agriculture, to our farm workers.
So, with limited time, I can't share everything that's out there. I can tell you there is a report on the DOH website, the Department of Health website, specifically on occupational infection rates. And I took a look at it, and it actually shows that agricultural workers have disproportionately high rates of COVID-19 positivity rates. And of course, the important thing here is this is not isolated to an exposure at work. An exposure at work leads to an exposure at home. And that's where issues of crowding and multi-generational households come into play, because we know the number one place where people become infected is in their home. It's very hard to isolate. You first have to know that you're infected, and then you have to be able to isolate, whether it's within your home or have a place to go where you can isolate in order not to infect others. So the issue among agricultural workers is extremely important, and is a major factor in high rates of infection in Eastern Washington in particular. We also know, though, Skagit Valley in Southern Washington has areas of agriculture as well.
Thank you. Thank you, Dr. Morales, for your participation today. We invite anybody else who have any other questions for future presentations, please type it in the chat. English or Spanish will be good for us. So please keep it on the chat. Well, thank you for your participation today.
Claudia, we have a question from the consulate's office, it looks like.
Go ahead.
It says, good morning. What are the main arguments or difficulties that the authorities have listed as to why this gap in attention to minorities is still in place after 2 years of the pandemic, Dr. Morales?
Well, I think what we're battling here is a long history of, disproportionate health issues among Latinos in the state. And this is only the most current one that has emerged and has brought this powerful lens on inequities that exist. I think that this is part of a long struggle. We won't solve it for COVID, but we need to pay attention to it, and hopefully we can address it through reform and through transformation. We really need to do a lot of work with communities, and whether it's investing in social services, addressing social determinants of health, improving educational systems that serve our young people. I mean, let's just begin to talk about that. What kind of impact is COVID going to have on a generation of young Latinos who have been, trying to get their education through online when they don't have the facilities to do so? These are so important. So it's not a situation that will be quickly solved, and we just need to sustain our attention on this issue.
Yeah, I think what you're referring to is this is more important than ever, that we are the advocates that work for the Latino population, that we are in tune of the possible consequences, because as you say, the consequences are coming up. We're going to see a lot more of the impacts in the years to come.
I think the last point I'll make is, as pointed out, the Latino community or communities in the state are growing. And so how they do has everything to do with how our state does. So wise leaders will invest, will make sure that we don't continue to see these inequities, that we start to address them in meaningful ways through serious investment. I think that's what we need.
Thank you. Thank you very much. Thank you, Dr. Morales. Thank you for your participation today. Some of you will see a poll that is running right now, and if you want to participate, please do so. We'll move into our next presentation. So our next presentation will be on Washington Department of Health response to COVID-19, a community perspective. For that presentation, I want to invite Angie Hinojos. Angie Hinojos is the Executive Director of the Centro Cultural Mexicano in Redmond. She serves on the Washington State Commission of Hispanic Affairs and is a member of the Washington State Pandemic After Action Review Task Force. She has a degree in architecture from UC Berkeley and has been a very important advocate for our communities in Washington State. Please help me to welcome Angie.
Thank you, Claudia. We are here. We are over 1 million proud Latinos in Washington State, 90% of whom are Mexican American. We stand in this moment on the precipice of a past riddled with inequity, marred by harmful practices, and saddled by antiquated systems that no longer serve. Our blood burns with unrest, ambition, and the knowledge that if we are to achieve the dream that compels us forward, then we must do it together. Here, where we gather in our virtual state capitol, we must entreat our legislators to continue to work with us toward immediate solutions to rebuild our systems in more humane ways. We are here. Our brilliant children are both burdened and empowered by the spirit of our past struggles. Are we worthy of the hope they place on us? Education, financial stability, the building of generational wealth, representation. These are the building blocks of empowerment. I can tell you many things, how almost a quarter of the children in our state are Latino. I can assert that in just 2 years, 1 in 5 workers nationwide will be Latino. I can share the wrenching fact that we are 14% of the state population, but we are over 30% of COVID infections, and that our age-adjusted death rate is the highest of almost any group. Dr. Morales outlined all of this very clearly with very real data. Latino college enrollments are down by 20% during the pandemic. The vast majority of our students are the first in their families to go to college. We are on the cusp of losing a college education for a whole generation of our youth who are now 2 times more likely to delay or cancel college than their white peers. The careers of Latino students and workers have been disrupted by the need to provide childcare and elder care at home because we do not have affordable options near where we live. There are 147 members in the Washington State Legislature, but just 7 are Latinos. We are grateful for their representation, but we are woefully underrepresented. Redistricting and voters' rights issues that pose barriers to fair representation are serious and must be addressed. But I don't have to tell you, my community, what we are living every single day. Many in our community have lost their entire life savings during the pandemic, their entire life savings that took years to build. And for our undocumented community, there is no health insurance and no unemployment benefits. We all know this. Those who have the power to change it right now, hear me, hear my voice. We are here. Facts cannot adequately convey the anguish of so many families who work the jobs that keep our state running. The greatest number of COVID outbreaks have been in workplaces with high percentages of Latino workers because they are high exposure jobs. Facts cannot convey the exhaustion of families trying to make ends meet after loss of jobs, lack of access to vaccinations, boosters, COVID tests, and PPE, all things Dr. Morales talked about, all while dealing with the high cost of food and rent. How can facts relay the desperation of a teenager who is struggling with depression and anxiety? Many of our youth don't have access to culturally and linguistically relevant mental health care in their communities. Our youth need us. Where is the balance of justice? When do we take a moment to look backward and take responsibility for our oversights so that we can change inequitable systems moving forward once and for all? Can we work together? Our disparate communities, our government, academia, all of us for a greater purpose, which is not just the benefit of Latinos statewide, but the benefit of all human beings who deserve and are worthy of respect, honor, and care. So my brothers and sisters, my siblings, what can we ourselves do? Those of us who are eligible to vote, let's get registered and let's exercise our power and vote. And it is power that we hold. To our youth, you are a force. Nationwide, 1 million Latino youth turn 18 every single year. I have had the pleasure to work with many of you who are already incredible leaders in your communities. Continue to be active, vocal, and involved. In my work, I have lots of conversations with residents from all over the state. I hear your ideas, your wisdom, and your solutions. Share those where you are able. Email your representatives, serve on commissions, leave messages for your school boards, run for elected office. Be the voice that is missing where decisions that affect us are being made. Change the conversation where you can. My sisters and brothers, my siblings, let's sing the same song. We all know the words, and we sing it with a sentiment born of truth. Let our voices be heard across the state as one voice, over 1 million strong. Juntos por la justicia y el poder. Thank you.
Thank you, Angie. Thank you for your wonderful presentation, incredible inspiration. So one of the questions that has been posed before is, and I can guess your answer, but do you think that the state and the local agencies had done enough to engage Latino communities?
We are in need of engagement through means that make sense to our community. And so we are looking to all of the agencies, all of our government, all of our agencies to work together with our community, with the needs of the community. And I think that message has been sent. I don't think that we have seen as much of a response in the way that we need to see it. So we need our agencies working with community groups, working directly with community, working on outreach and education, all the things that Dr. Morales talked about. That is the resources are not getting to the people, and we need it to.
Agree. We have a comment and an answer into our chat. It says, what kind of trust building activities have been done between Latinos and public health state government? Trust, I think the trust building needs to be a top priority. To do this, we have to admit BIPOC communities do not trust the state and health agencies.
I think that the conduit for those conversations, it falls to community groups, community-based organizations that are already working within community that actually represent the communities that they serve so that they are part of the community. That is kind of the glue between the people and the agencies. That's the bridge. And I think that there is a huge opportunity statewide. There are so many amazing organizations doing incredible work, and there's a huge opportunity there to have that value in order to maintain and build trust.
Yes. Angie, I really hear and I'm in agreement with you when you say we have to develop outreach that match the needs of our communities. We had experienced a lot of difficulties, specifically with the type of outreach that was done to the farm workers in the Skagit area. I heard by a specific promotora de salud who work under CMAR, the organization that I represent, where they were telling me that when the outreaches were knocking at the doors, they thought they were part of immigration. And they didn't want to open the door. So they had some people who did not have the trust. They didn't recognize the faces, so they will never open the doors. So you can see how they're missing the whole point, right? It's not to do what they do to our communities. It has to be very specific to the needs of our population. And that's a wonderful thought that you expressed this morning. Thank you, Angie.
Thank you.
Thank you, Angie, for your participation. We are going to move to our next presentation. So I would like to introduce Charles Watrix. He will be doing a presentation this morning in the impacts of opiates and fentanyl in many communities, giving us some data specifically for the Latino population. Charles Watrix, goes by Chris, is a licensed clinical social worker, licensed substance abuse treatment practitioner, a master addiction counselor with over 20 years of experience working in human services. Chris currently works as a senior program associate of program development with Ascension Recovery Services, where he helps to build comprehensive substance abuse treatment programs across the United States. Chris is also the interim medication assistant treatment program director for CMAR Community Health Centers, where he developed and implement their comprehensive addiction medicine program in recent years. Chris' work has been featured on NBC News and the Seattle Times for advocating for better access for substance use disorder treatment. Please help me to welcome Chris to the podium. Thank you, Chris.
Thank you, Claudia. Good morning. Those are going to be two hard presentations to follow, but I'm very, very grateful for being here today. This is my 7th year in being able to participate in Latino Legislative Day and my first year in presenting. And when Claudia asked me a number of weeks back about if I was interested in talking about the topic around opioids, I jumped at the opportunity. It's a very important topic. It's also a very large topic that's complex and has a number of different layers to it. And I wish I had several hours here with you today to be able to go into more detail, but unfortunately I only have about 20 minutes. So really my goal of today is to provide a very high level overview and being able to understand the important pieces around opioid drugs. I think before we really jump in, I think it's important to first look at why is this important? Why are we looking at this? And it's hard to escape the news cycle nowadays without seeing or hearing about overdose deaths or deaths related to opioid use or fentanyl and our drugs that we're seeing today. It's estimated that over 2.4 million people in the United States suffer from opioid use disorder. And our overdose deaths have continued to dramatically increase. You know, we were finally starting to see the numbers go down around 2018. In some areas, they were still going up. 2019, we recorded close to 71,000 overdose deaths. And then we got hit with COVID-19. And the numbers have just been staggering ever since then. And our most recent numbers that came out in April of 2021, which is almost a year ago, we've topped well over 100,000 deaths. And my hunch is it's certainly related to COVID-19 as well as fentanyl, which we'll talk about here in a little bit. You know, Washington State is certainly not immune to this. You know, we've had over 1,200 deaths from opioids in 2020. And unfortunately, communities of color seem to be the hardest impact. Deaths among white people rose 24%, overdose deaths in the Black population jumped by 90%. American Indian, Alaskan Natives jumped by 169%, and Hispanic populations we saw increased 115%. And you can see this graph here that I have, you know, from the Washington State Department of Health. The yellow bar is 2020 here, and you can see compared to the previous years, in the first, second, third, and fourth quarters, then we've seen dramatic increases in drug overdose deaths. You know, unfortunately, I can't explain the large differences that we're seeing in deaths amongst the communities of color, but we do know amongst drug users is that they're dying from fentanyl. If you're not familiar with fentanyl, it is a synthetic opioid that's about 50 to 100 times as powerful as heroin. You can see the pictures up on your screen here. You have on the left a potentially lethal dose of heroin, and in the middle is a potentially lethal equivalent dose of fentanyl. And you can see that it takes much less amount of substance for the lethal overdose. And then even in the far right, you have carfentanil, which is even more powerful and high risk. And the penny in the picture there, I think that puts into perspective there about how much or how little of this substance it takes for a potentially lethal overdose. And so fentanyl is very cheap to manufacture. A small amount goes a very long way. And oftentimes many individuals don't even know that they're using it. So what's happening is people who may have a prescription for an opioid or are using illegally and buying them off the streets to supplement because they need more, or buying them online, they think they're buying prescription opioids that come in the form of oxycodone or Percocet pills, and they look very, very real. You can see in this picture here is a picture of an M30 oxycodone, but they're counterfeit pills, and they're oftentimes laced with fentanyl, and people are taking these medications for the first time. They haven't developed a tolerance, and they're overdosing and even dying. So it's really important to recognize. And I would say that pretty much anything that you buy now, it's really hard to find heroin on the streets nowadays. Pretty much everything in terms of opioids is laced with this high, powerful fentanyl that we're seeing here in Washington State. You know, also to continue answering the question of why, there's just a list of things, and this is addiction in general, not necessarily from opioids, but that we see, you know, impacts from substance use disorders that I thought was worth listing out, and tremendous amount of different impacts, you know, intimate partner violence, we see child abuse and neglect, sexual assault, homicide and violent crimes, roadside injuries and fatalities, unwanted pregnancies, development of dysfunctional family systems. And the list continues on, you know, prenatal drug exposure. We see developmental impairments, spread of communicable diseases such as HIV or hepatitis C, mass incarceration, high healthcare costs and raised taxes, failure to achieve unemployment and homelessness. You know, I was reading something in preparation for this that, you know, it costs over $740 billion that's related to crime, lost work, as well as healthcare expenses around substance use disorders. And people that work that have a substance use disorder, they miss nearly 50% of their work days compared to their peers, which is about 6 weeks annually. So tremendous amount of impacts from substance use disorders. So back to opioids. What are opioids? If you're not familiar, opioids are a class of drugs naturally found in the poppy plant. And I've got some pictures here of the opium poppy. It's illegal here in the United States. And opioids typically refers to those natural opioids that come from the poppy plant, but it also refers to the semi-synthetic and the synthetic opioids. And opioids work in the brain to produce a number of effects, including pain relief. As mentioned earlier, this includes the illegal drug heroin. It includes your synthetic opioids that we just talked about, fentanyl, and it also includes your pain medications that are available by prescription, such as oxycodone or hydrocodone, codeine, morphine, and many others. You know, most prescription opioids are typically prescribed to treat moderate or to severe pain. Opioids can create, you know, make people feel relaxed, happy, or even high, creating a feeling of euphoria. You know, it doesn't happen with everybody that takes an opioid. Some people will report that they didn't like the effect of it. Some people will not report this effect. It's a really red flag for folks. You know, if the first time that they're taking one of these medications, whether it's prescribed or whether it's illicit, if they have this initial effect where it feels good and they like it, that's a red flag that they have, that they could develop an opioid use disorder further down the line. It's a risk factor. So that's worth mentioning. And regular use of an opioid can lead to tolerance and dependence, which I'll hit on here in a second, and in some cases lead to addiction. So opioid tolerance is when occurs when a person using the opioids, the opioid medication has a reduced response, meaning the medication stops working. And so what happens is they develop this tolerance over time. So they have to start taking more of the medication or start taking it more frequently to get the same desired effect. And opioid dependence happens when a person has been taking it over time and the body adjusts to it. It adjusts its normal functioning around the opioid use. And what happens is when the person stops taking opioids, they start having unpleasant side effects known as withdrawal. And withdrawal symptoms can be pain, anxiety, depression, restlessness, diarrhea, vomiting, runny nose. And, you know, if you've ever known anybody that has been physically dependent on prescription opioids or has an opioid use disorder, and if they stop taking them and they've talked about this withdrawal, they will tell you it's the most horrible thing that they've ever gone through physically and somewhat mentally too. A lot of people compare it to the flu, but the flu really doesn't do it justice. I mean, horrible pain, and it's just excruciating if you've ever heard anybody describe going through this process. Opioid addiction often comes after the person has developed opioid tolerance and dependence, and it makes it really physically challenging to stop the substance or the opioid, because when they do stop it, they start experiencing those uncomfortable withdrawal symptoms that I just mentioned. Here's a brief definition of opioid use disorder. This definition doesn't really do it justice either. Opioid use disorder and opioid addiction is very complex. The American Society of Addiction Medicine's definition is about 7 pages in length. Their short page definition is 1 page in length. So I've trimmed it down to really what it boils down to is when the person attempts to cut down or wants to control their use, but they're not successful. And or it may result in social problems as well as failure to fulfill their obligations at work, school, and or home. But again, that's a really simple definition. And if I had another hour with you here today, I could probably elaborate a bit more. So how do we know if there's a problem? You know, the warning signs I think to look out for, certainly if your having any prescription opioids is starting to take more than prescribed. So you're running out of the medication early, or you're starting to take more of it, or start taking it more frequently outside of the guidelines of how the doctor prescribed it. Illegal drug use is certainly a red flag. Oftentimes people that are prescribed long-term opioids, what we'll find is they run out of their medication early, and then they start supplementing from opioids either from a friend or another family member, or buying it illegally off the streets. And again, that's where it can be dangerous, where I was talking about earlier about fentanyl, and they think they're buying this pain medication, but in terms it's a counterfeit or fake fentanyl pill. Other warning signs we see is craving for the drug or substance. So they start thinking about it all. Their whole entire thinking is really preoccupied with the drug and how they're going to obtain it and where they're going to get it. We see lots of changes in mood. Person can become irritable, depressed, suspicious. We see changes in sleep, weight loss, the flu-like symptoms, similar to what I mentioned with withdrawal earlier. Usually hygiene gets poor, and they start isolating from family or friends. And then as it progresses, sometimes we can see illegal activities such as stealing to help continue paying for the habit. So talking about opioid use disorder treatment. As we look at this, and I've got it compared to diabetes, really, just like any of the substance use disorders, opioid use disorder is no different. We consider it a chronic disease, and therefore we sort of take a chronic disease-based model and approach at looking at it and treating it. And in that disease model, opioid use disorder, just like diabetes, we know that there's a structural or a chemical defect in the body. With opioid use disorder that's developed in someone, there's permanent damage that has happened at the brain. And just like diabetes, the same is true for the pancreas. We know that the chronic diseases are caused by a combination of behavior and genetics. Most people need medication to be able to treat them, and the same is true for opioid use disorder and diabetes. There is no cure for it once the opioid use disorder is developed. So really our goal is control of the opioid use disorder and knowing that relapse happens. Recovery is also possible. I think this oftentimes gets eclipsed by the bad news that we see from the overdose deaths and sort of hopelessness. But there was a recent study, I think a recent article that came out by NPR News, I think a couple of weeks ago, went over a bunch of different studies that really says that most people in the US who experience alcohol and or drug addiction do survive. And studies have indicated that 3 out of 4 people who actually experience addiction eventually recover. So in terms of opioid use disorder, the main thing is really working to stop the addiction cycle. The good news is we have medication-assisted treatment, evidence-based medications that work really well, in particular to opioid use disorder. We do not have many or really any other medications for the other substance use disorders, but we do for opioids. And these medications work really well, and there's a lot of evidence behind them. Some folks may be familiar with these. More common names is methadone, Suboxone, as well as Vivitrol or naltrexone. I think it's worth mentioning that Vivitrol or naltrexone is also a great medication for alcohol use disorder. A lot of the attention and media is around opioids and the fentanyl overdoses, but we still have a really significant problem with alcohol and alcoholism. And naltrexone is a great medication to help folks cut back on their drinking that may have, really heavy drinking or heavy binge drinking. So also inpatient hospitalization sometimes is necessary to get folks out of their unhealthy environments, to get them away from their substance use, to get them started on medications. Oftentimes that's the last resort for opioid use disorder. Many times we can stabilize them on an outpatient setting with medications. But again, sometimes they do need inpatient hospitalization. I think it's worth mentioning that there's a lot more than just medications. What we're doing here as a person goes through the stages of recovery if they've developed an opioid use disorder is literally rewiring the brain by how they think and act. And so that takes a lot of work and a lot of time. And we do that through outpatient counseling. It's also important to look at social supports, setting up healthy structured activities, self-help support, and making sure that we're addressing the other underlying mental and medical health issues that may be going on. If it's a chronic pain issue, we need to address it. If the person has depression and they're taking the opioids because it works great with their depression or did initially, then we need to look at and be addressing those as well. It's also important to consider family support and involvement. Family can play a major role in helping a loved one with the substance use disorder. They may be more likely to notice when something's going on, when one of their loved ones is experiencing a change or mood or behavior. And family members are great at being able to connect those in need with treatment resources or services. So what else can we do? It's important if you have any of these medications in your home to lock these medications up. Get you a lockbox. If you take prescription opioids and they're in your home, making sure that they're safely away from others. I've been doing substance use disorder treatment for well over 10 years now. And one of the initial sessions that we have when we meet with somebody coming into treatment is to go through their substance use history. And time again, I've heard so many stories start out where when we ask about the first time that they used one of these opioid medications, they were typically a teenager, 14, 15, 16 years old, and they were getting it out of their parents' medicine cabinet, or they were getting it out of a grandparent's medicine cabinet, or a friend's going over to their house and getting it out, and they were available there. So it's really important if you take these medications to keep them locked up. Also important is if we have these medications in our home and we're not using them, then getting rid of them and disposing them. The risk of continuing to keep those medications in our home is just too high if we're not using them. Oftentimes it's our habit is we hold on to those older medications thinking that we may use them for another time or we may need them in the future. But again, the risk for these medications and continuing to keep them in the home is too high. There's a number of ways to be able to get rid of those unused or unwanted medications. Many pharmacies across the state have return drop boxes. If you look in the picture here in the lower right-hand corner, that little blue mailbox looking thing next to the pharmacy there, those are set up across the state where you can bring in your unused or wanted medications. You just need to find a site. And Washington State has actually started prepaid envelopes where you can send your order in for unused or unwanted medications too. So the other important thing is if you or a family or a friend is regularly prescribed any of these medications or they're taking opioids, make sure that you're trained in how to identify and respond to an opioid overdose and carry Narcan. It's really simple training. It is a nasal inhaler spray. I carry mine everywhere I go with me because you never know when you're going to come across somebody nowadays that's in the middle of an overdose. And it's very simple. It's harmless to those that aren't using an opioid. And you just simply put it in the nose and inject it into the nostril to help reverse the overdose reversal. So here's a list of resources that I think is important to look at. If you or a family or friend or loved one is struggling or concerned, with any substance use disorder, the Washington Recovery Helpline is a great resource, being able to link with treatment services and being able to find help immediately. The second link that I have here, the Safe Medication Return, that was what I mentioned as far as the Department of Health, where you get the free prepaid envelopes to send your unused or unwanted medications. And I also have stopoverdose.org's link here for the overdose education and how to receive the Narcan. Washington State does have a standing order where you can walk into any pharmacy without a prescription and pick up Narcan too. So that's really good. And I have my contact information below. So certainly if we're not able to answer any questions today, feel free to reach out to me and I'm happy to help. So with that, that's all I got. I don't know if there's time for questions or if I overwent my time. So.
Thank you, Chris. Thank you very much for the presentation today. Yeah, we have a few minutes that we can ask some of the questions. One is a little bit of how this relates to our Latino communities. What's the relevance of this issue in the Latino community?
I think the relevance that we're seeing is that the high overdose rates with the fentanyl. And I think in that earlier slide, we're seeing amongst the Hispanic communities here in Washington State, overdoses increased 115% significantly. So unfortunately, people are dying out there and we're not exactly sure why. Sometimes it's not due to prescription medications, it's illicit use. And so I think certainly being able to engage the Latino community and getting them connected with treatment.
Agree. We have a treatment center specifically for youth here in Washington State, and we also have treatment centers for adults. And we see an increased number of patients coming through where they are addicted to opiates. So it's very relevant to our population. What we see is sometimes the Latino population do not have the education of what symptoms to look for. So we think there is something else and a different issue, but it's really related to opiate use and fentanyl. So I think this is very pertinent and applicable to the Latino population. One more question. Can pre-exposure to mental health disorders impact opiate usage later on?
And I think I understand that question. If somebody has an underlying mental health issue, such as depression or anxiety, it certainly can impact it later on. Oftentimes what happens is if somebody has untreated depression or untreated anxiety, and they may go to the dentist and get prescribed this medication, and they take it, and all of a sudden they take this medication and they feel good. It gets rid of their depression. Opioids work really well initially the first couple of weeks at treating depression. And so that reinforces them continuing to take that substance. And so we do see people that have underlying mental health issues, as well as adverse childhood experiences, are at higher risk if they end up taking these medications for developing opioid use disorder.
One more question is about, we know this is impacting the Latino communities. One of the barriers that we're facing is the lack of funding specifically for the uninsured Latinos. How can they get help if there are no funding available?
It's a good question. I wish I had the answer for that. Oftentimes times the number one treatment for people with opioid use disorder initially is medication-assisted treatment. Some of those medications can be very costly. Prices have come down over the years. So it's a really challenge. So a lot of times it's without insurance or coverage, it's finding low-cost medications for folks or looking for other treatment options, which usually includes inpatient hospitalization without medications. And unfortunately, that's not very successful for a lot of folks.
Want to, with the experience, Chris, that we have over at similar community health centers, want to mention that every county has what they call the ASOs. ASOs are organizations at the county level who receive funds from the state to really address issues for those who are uninsured. They don't have Medicaid. So the service, what we need to do is access that type of funding, working with organizations who are already providing this type of services, say CMAR or other organizations who provide substance abuse services will help us to access that type of funding. So there are some funding available. Many times we can also bring people into a residential treatment without the funding. I would suggest that working with organizations that provide substance abuse services probably be the best avenue to be able to access services for uninsured. We are running out of time, so I will pass it to Nina.
Claudia, thank you so much. I would like to recommend, because of the opiate and fentanyl epidemic, what we need to do critically for Latino communities in the state is organizing more roundtables and discussions, connecting other organizations that are doing work, finding out what resources are available, because I think that is a huge gap right now for Latino communities, because really we're working with families, Latino Civic Alliance directly at our center, and they don't know where to go. And so we need to come together. And so my recommendation very soon is that we organize a roundtable discussion. So thank you, Charles, for joining us. Thank you. So our next presenter will be Jorge Barron. It is the immigration panel, and he will be updating us on DACA. But a little bit about Jorge Barron. He is the Executive Director of Northwest Immigrant Rights Project since 2008, having previously worked as staff attorney with the organization for 2 years. Northwest Immigration Rights Project is a nationally recognized legal services organization dedicated solely to advancing and defending the rights of low-income immigrants. Welcome, Jorge.
Thank you so much, Nina, and thanks to everybody from Latino Civic Alliance for organizing this wonderful event today and for many, many years. And I appreciate the opportunity to be able to talk to all of you. And thank you to all the co-panelists who've been sharing their wisdom and expertise. I have a very short period of time to talk about a topic that I could speak for hours, so I'm going to kind of quickly get to it and share just a few slides here that I have to be able to guide us through this conversation. I wanted to explain a little bit about our organization. For those of you that aren't familiar with Northwest Immigrant Rights Project, we're an immigration legal services organization providing assistance here in Washington State. We primarily focus on providing direct legal representation for community members, but we also engage in systemic advocacy through litigation as well as community education. And we have 4 offices in the state, 2 in Eastern Washington, in Wenatchee and Granger, and then offices in Seattle and Tacoma as well. The focus of my presentation today is just to give you a very quick update on where we are in immigration policy at the federal level and a particular update on the DACA program. And so I'm going to just quickly give you a recap of what's happened over the last year in particularly once the Biden administration took office in January, because there's been a lot of proposals and things that have been put forth, some of which were very potential positive developments in terms of immigration legislative proposals. But unfortunately, not a lot of actual changes, at least on the legislative front, that we can report on. So just to remind folks, and I'm focusing, there's been a lot of other things that have been introduced that are more narrow, but I'm talking about sort of the bigger major legislative proposals that were made during 2021. And so we started the year with President Biden sending to Congress on his very first day in office something called the U.S. Citizenship Act of 2021, which would be a major overhaul of our immigration policy on many levels. And I'm not going to get into the details here because of the limited time, but it would have changed, made dramatic changes, provided a path to citizenship to millions of people around the country who currently lack status. That bill was introduced in Congress, but there's been no action. It hasn't been taken up by either the House or the Senate, unfortunately, although components of it were taken up in different other bills. So unfortunately, that bill has not moved forward. There's also been where there has been some movement and significant movement has been on other proposals, including something called the American Dream and Promise Act of 2021, which follows kind of a long running pattern of similar proposals known as the Dream Act over the years. This would be a little bit more expanded. It would apply to people who have been, for example, DACA recipients, other people who came at a young age to the U.S., people who are covered by a temporary protected status program. And so it would provide those individuals a path to citizenship and make other important changes. That bill passed the House in March of 2021, but it has not been taken up by the Senate. And here I would say that I think part of the reason for that has been because there's been opposition in the Republican Party, and that has made it so that at least the Senate leadership has judged that they couldn't get the 60 votes that it would be needed to be able to move that legislation forward in the Senate. And so that's kind of what we need to focus on, is how do we make sure that things move in the Senate, because as you'll see, you also have other bills like the Farm Workforce Modernization Act that would provide a path to citizenship to people who have worked in the agricultural industry, and provide a path to citizenship again to undocumented workers in that industry in particular. So it's a little bit more limited. And I will say that there's been a number of concerns with that bill in particular, but that did pass the House in March of 2021. And again, there's been no action in that bill in the Senate. So I think because there wasn't movement earlier in 2021, a lot of the focus, and again, because of the requirement of the filibuster, the 60-vote rule in the Senate, a lot of the advocacy towards the end of 2021 has been focused on, more recently, has been focused on something called the Build Back Better bill. And this is a bill that is going through a process known as reconciliation in the Senate. And the reason that is important is because that process would reduce the number of votes that are required for the bill to move forward to 50 as opposed to 60. However, in order to qualify under the reconciliation rules in the Senate, it has to meet some very specific criteria that deal with impacts on the federal budget. And so that means that according to certain rules, not everything can get through under this reconciliation process. Now, when that bill passed, the bill passed the House in December, and it included some important immigration provisions that would provide a path to citizenship to millions of people around the country, and some very significant reforms. However, the bill has not moved forward in the Senate, and I will say that it hasn't moved at all. So there's been some opposition, particularly by Senator Manchin from West Virginia. That's meant that bill has not moved forward at all. But there's also been questions specifically about the immigration provisions, about what could be included, because there's the Senate official known as the Senate parliamentarian that analyzes what they consider what this individual believes meets the criteria for the Senate rules. And unfortunately, she has ruled, or at least advised, that the three different proposals that Senate Democrats had put forth in terms of immigration did not comply with the rules. Now, our position is that the Senate parliamentarian is not the final judge of this. Ultimately, we believe the Senate, the president of the Senate, who is actually Vice President Harris, has the authority to rule differently than what the parliamentarian has said. But that's still up in the air. And so I think one of the issues that many of us have been advocating for is for the administration, particularly for Vice President Harris, to overrule the parliamentarian on these provisions. But it's not clear that that's going to happen. And so the summary of all of this is that, unfortunately, while there has been a number of proposals that have been put forth, unfortunately, at this point, there have not been any significant changes made to immigration policy through legislation so far in the Biden administration, and I think many of us want to continue keeping the pressure up on our congressional representatives, certainly, to make changes there, and that's something that I think over the next few months will be particularly important, because as we get closer to the midterm elections, changes will be even more difficult to pursue. So next, I just wanted to give a quick update about the DACA program. And again, this is obviously just a reminder for everybody about the DACA program. So this is the Deferred Action for Childhood Arrivals program that was launched in 2012 under the Obama administration. There were many attempts that I'm not going to get into detail here during the Trump administration to try to eliminate the program. And thanks to the leadership of undocumented community members themselves and a lot of litigation work, those attempts were, for the most part, prevented during the Trump administration. There were, however, impacts in that new people could not join the program during the Trump administration. So all of that meant that people who were in the program, were able to continue renewing the program during the Trump years, and still to this day. We had a lot of hopes that there would be, further expansions and obviously, legislation addressing DACA recipients. The good news is that when the Biden administration came into office, of course, they ended the attempts to end the program themselves. So we didn't have at least the federal administration trying to end the program as we did during the Trump years. But the issue has shifted in that other states, and particularly the state of Texas, has been leading this litigation effort through the federal courts to actually end the program that way. And unfortunately, in July of last year, we had a bad ruling from the U.S. District Court in Texas that said that the DACA program was unlawful when it was initially launched, and ruled that it would need to be ended at some point. But the good news is that or at least temporary good news, was that the district court said that ruling would be on hold until any appeals were concluded. And so right now, the situation with the DACA program is that even though there was that negative ruling in July, the program can continue to be in place for people who are already in the program. So DACA recipients who are currently in the program, who have been in the program in the past, can continue renewing their work permits. There's a small exception for people who let their work permits expire for more than a year. For them, right now, they're not able to renew, but might be, depending on what happens with this litigation. Now, as part of their effort to try to make sure that the DACA program continues to be available, the Homeland Security issued a proposed regulation for public comment in September. A number of people provided comments on that. We're expecting there's going to be kind of a final regulation. At the end of the day, that even though there's that process through this regulatory process, that doesn't resolve the issues. We really need to focus on legislation ultimately, because that's the only thing that's going to provide kind of clarity and a path to citizenship to people who are either eligible or already in the DACA program. But my key message is that if folks who are in the DACA program can continue to renew and should be, continuing to renew despite the current threats, as the rest of us and everybody else is working to make sure that we have a final resolution for folks. The final thing that I just wanted to mention, we talked about the federal issues, and obviously we talked about how lots of things are not happening at the federal level. We should continue, of course, the pressure on that. But I'll remind the work that, there's still a lot of work that can happen at the state and local level. We've had a lot of successes here in Washington already. by the work of a lot of organizations and organizers that have spearheaded this, including LCA. And so we should not forget about the fact that there's work that can be done at the state and local level that affects our community members. And obviously that's a lot of what we're talking about today. So we want to make sure that we continue that. And then finally, I'm just going to leave our website for folks. If there's questions or updates on federal policy, please don't hesitate to reach out for that. And I see my time is nearly over. So I don't know, Nina, if we have any time for questions, but that's it.
Yeah, we did. I know that was wonderful. I just last comment is, what are the fees for the applications? Have they increased? Or they, I know there have been a lot of questions because people do need assistance for those fees. Are they, any updates on that?
Yeah, well, so there were a lot of attempts during the Trump administration to try to increase the fees. There's still litigation on that, and thankfully, we've been able to prevent some of the really obnoxious fee increases on top of what they already high fees. So some of those changes have not happened. I think that the Biden administration is looking at that anew. I will say that there are some efforts locally. I can say, for example, in King County, the county allocated some funding for a program that will help people cover some of those fees who can't afford to pay. That program is not quite implemented yet, so it's not available right this moment, but we're expecting that will happen. And we hope that there will be additional opportunities for people in other parts of the state to also have opportunities like that. So that's what I can say about the fees issue.
Well, thank you, Jorge. As usual, you're wonderful, informative. So thank you for joining us today. So our next presenter will be in relation to small business. I'd like to present Vicky Centarelli. I hope I said that correctly. And a little information about Vicky. She is a principal at Centarelli Associates. Vicky has 42 years of experience managing, recruiting, and working with minority and women-owned firms. This includes working with local communities, assessing the capabilities and capacities, providing coaching and technical assistance, recruiting, and working with these firms for construction, consulting, procurement, and assisting these firms develop relationships with prime contractors and consultants. I can tell you that right now, Washington State, we need leaders like yourself, Vicky, to help our small businesses. So thank you for joining us today.
Thank you very much. I'm going to go ahead and pull up my screen. There we go. And it looks like folks can now see that. So what I wanted to be able to do was share with you the recent signatures for the governor's executive orders, and executive order is, so it's EO for executive order 01 and 02. And so I'm going to focus on that and then some next steps and what this means to small businesses. So to give you a little bit of background, back in 1998, the Washington voters passed what was called Initiative 200, and it was supposed to talk about making education, hiring practices, and contracting practices with government to be equal, and to, in some ways, do away with what was referred to as the affirmative action programs of the day. So let's start with what Initiative 200 or I-200 actually did. What it did for our state laws was it removed any mandatory goals based on race and gender. It removed the authority to reject the low bidders who didn't meet utilizing women and minority businesses in their goals. It eliminated price preferences and preference points that were based on your race, gender, color, ethnicity, or national origin. And it also removed consideration of race, gender, color, ethnicity, or national origin in any final selection or award. So whether it was in education and contracting or so on, you could not use that as your deciding factor in that basis. What it did not do was it did not do away with our contracting programs and our laws as related to working with minority and women business enterprises. And it continued to allow for certification of our firms, minority firms. And we still encourage folks to get that certification as an MBE, minority business enterprise, or an MWBE, a minority woman business enterprise, and a disadvantaged business enterprise for federally funded projects. It also did not remove the requirements or the need to do inclusion, outreach, recruitment, and to have supplier diversity programs for these firms. And it allowed for voluntary goals to be set for purchasing and contracting with the government. State and local governments still had the authority and actually the duty to identify and remove barriers in contracting and purchasing. And this is what we refer to today in the terms of systemic and institutional racism. Government has always had the authority and duty to eliminate these from its practices and to ensure that we have equity and inclusion in what we do on a daily basis. And these state and local governments monitoring and reporting requirements and duty to share that information with the citizens and residents of Washington State has never gone away. So to move forward, had a directive that back then in that time period of 1998, 99, that then Governor Gary Locke provided. And this directive was his instructions to government agencies, specifically state government, with an ask of higher education, your universities and community colleges, that we were not going to have affirmative action programs anymore, was basically the end result of that. More recently, this year, our governor, Jay Inslee, came out and rescinded that directive from our previous governor, in part because there's been more recent information and interpretation from our state attorney general's office as to what the real intent and what the real meaning of Initiative 200 was. So as a result of that, we ended up with two specific executive orders. The first one is referred to as, that I'm going to go through, is equity in public contracting. And I have provided for you a summary of the multi-page directives so that folks that are interested in having the summary can use that as a tool to remind themselves about what this means or doesn't mean, because there's going to be a lot of information and misinformation about what these executive orders really mean and do for us as Latino business owners. So it requires the state agencies to adopt and implement the Washington State Tools for Equity in Public Spending. What this is a specific training and tool program that the Office of Minority and Women's Business Enterprises, also known as OMWBE, put together to help bring firms into a place where they can begin to embed equity, diversity, and inclusion into their culture as well as into how they do procurement. And this, their tools that they've come up with had input not only from the agencies themselves, but also experts in the field and input from their advisory committee that they have that comprises of a variety of business representatives from our various communities and other organizations. So it also now requires our state agencies to do outreach, to do actual searches in the various directories and systems out there, and to include plan discussions in their pre-bid conferences. So when they want to do some work with the out in the industry, they typically will schedule a meeting either through video or by in person, where folks can ask questions about those projects so that they can understand what is being asked and be competitive. And they are now going to be required to also have inclusion plans if those inclusion plans will be part of a contract execution. OMWBE is going to lead in the data collection and tracking. And so we will be able to once again get reports about not only award, but participation of minority and women's businesses in procurement and contracting. State agencies are also going to be able to track and measure their own participation as well. And that there are master contracts that another department, the Department of Enterprise Service, is responsible for. These are what we call master contracts. These are contracts where everybody uses them. And not only do state agencies use them, but local jurisdictions such as cities and counties and other types of government agencies can use these master contracts. They're available for a lot of folks to use. And they are going to have to now look at their policies and their practices to make sure that access is improved upon than where it is now. Also, the Department of Transportation and DES are going to be required to look at bonding, insurance, retention, and experience requirements to make sure that those requirements don't create barriers for our small WIMBY firms, our women and minority-owned businesses. In addition to that, there's going to have to be a designated staff person in every state agency that has direct access to the department head, that will be able to integrate the tools and best practices and basically be the point person, the lead person to change the agency culture to start incorporating inclusion in all of its procurements. And that person will also be responsible to put together the inclusion plan or do a risk assessment for that government agency. And that has not been the case historically. And then OMWBE is required now to provide training, guidance, and the technical assistance to these state agencies. I am proud and pleased to say that OMWBE is already ahead of the curve and has already put together the workshops and the beginning of the trainings and the conversations with state agencies as actually they started that last year and are ahead of the curve in trying to begin the implementation process. And then all of the state agencies are going to be required to adopt this OMWBE program that they're going to need in order to implement that. And we will be seeing quarterly reporting of the goals and participation. It will be mandated that by June 30 of 2023 at the latest, it will have to happen. Now, our other order that we're going to talk about is called Achieving Equity in Washington State Government. And while the first one is really about procurement and contracting with women and minority-owned businesses. So it's specific to that component of what I-200 impacted. This executive order is more broad and it covers all of it. So this works with the rescinding that Directive 9801, but it does not alter any state and federal affirmative action requirements we still have always had in place, even after Initiative 200 was passed. And in public contracting, it is basically requiring OMWBE to ensure the implementation of the first executive order that I talked about, EO 2201. Now, in addition to that, we have public employment. And so the Human Resources Agency is going to be responsible to address and dismantle any oppressive or discriminatory systems or practices in the workforce. They're also going to be required to develop equitable systems to replace the race and institutional racism, systemic racism systems that have been historically in place. So it's not just dismantling the stuff, but also coming up with its replacement. In public education, we have the Washington Student Achievement Council that needs to provide a report to the governor about student access and success, faculty and staff demographics, and any programs that are designed to remedy discrimination. And in addition to that, the superintendent of public instruction is being asked to provide any additional solutions specifically for the kindergarten to through high school public school system. With regard to public services, because this also impacts that, you've got service delivery, program development, policy development, staffing, and budget that is has to be addressed. So this whole overlay of not dealing with discrimination in that basis is also going to be affected by that, and it will be impacted in future rulemaking and those kinds of elements that policies and procedures that state agencies have to put together. So this is a nice overview of what those executive orders mean. And then let's talk about for briefly, what does it mean to our businesses, those of us that are currently business owners? What are we going to see? For now, we're not going to see any immediate change. And that's in part because this is a moving target and a continuous improvement effort that's going to start to take place. And even though OMWBE, for example, has already started the training and designing of the tools and all of these components, it takes a while to get all of that information up into the state agencies, because there's quite a few of them, and then getting everybody on board so we can move forward. So it's not going to affect private sector work. It's only going to affect most immediately state agencies. So what we will begin to see this year and into next year are more inclusion plans being allocated or assigned to solicitations. We're also expecting to see more emails from the web system. So if you want to do business with the state, you need to be registered in their solicitation electronic system called WEBS. And if you are in that, you'll begin to see more emails inviting you to submit or respond to a solicitation. because some agencies do that routinely. Others haven't really started that process. So we'll see that. Then the other piece is, if you're going to be asked, if you're not certified by OMWBE, you're going to see more asks or requests to get certified, because the firms will need the state agencies want to be able to count certified firms in their reporting so they can show progress. So those are the three big things we're going to see. But there's some things we need to ask, because this is a baseline. This is a starting point. This isn't the answer that's going to solve the problems that we experience, the barriers we see, the challenges we have when we try to do business with government. What we need to ask is not only that we see inclusion plans, we need to ask that the inclusion plans be integrated and scored. They become more mandatory as part of the process. So we want to maximize opportunities, and if you track it, it doesn't count, it doesn't exist. The more we track things, the more it means something to somebody. We want to ask for more best value solicitations rather than low bid solicitations. And the best value means that the special things that our small firms do, that niche that we provide, that makes us stand out, us be stars amongst our competitors, begin to count for the scoring in the selection process. We also need to have direct conversations with our legislators about what our barriers are to access and technical support that we need, rather than being told these are what our barriers are, or what kind of support we will get based on what's available. So we need to strengthen our conversations with our legislators by our needs. The other piece that we want to do is talk briefly about the unique position that we as Latino business owners are in. So as Latinos, Latinas, we are a diverse peoples. And I use that plurally because we have many different stories about how we ended up here at this place in this time. Now, while we have different and variant customs, and in some cases languages, we do have one thing in common, and that is we share our love of family and community, and we have a history of supporting and caring for each other across the board. I can tell you stories how as a Peruvian, my dad would bring home Peruvians he met somewhere, we'd never met them before, and we would bring them in and make sure they had a hot meal and help them, and they would stay and we would talk, and we got to meet lots of fellow Peruvians, and sometimes it wasn't just Peruvians, it was other folks he would sometimes bring home. So this idea of community and family as one, I think, is part of who we are. As business owners, we're responsible for our families, our workers and their families, and our community. And in some ways, we do double duty, because when we pay taxes, we're not only paying for our own individual, we're also paying for our businesses. And we're investing in our workers in a variety of ways, including benefits and paying into some of the other Social Security and other taxes that we put in. One of the things that we need to make sure we do is work together so that we all prosper as a community. And that is probably how we lead our message about small business with our legislators. So what we need to be is in a place where we take a stance to not pass any bills that pit workers against small business owners or small business owners against workers. The programs that are being put together for our business we need to make sure that we don't leave our workers behind. And so as we look at tools and ask for things, we need to make sure those are in place. And we need to stand and support each other throughout this. So while this is the beginning of where we're going as it relates to these new tools that are going to be requirements for the state, we want to make sure that we shore up the other components that are mentioned in EEO, the EO 22-02, because education, business entrepreneurship, workers and employment, and just general services are all intertwined to ensure a finely knitted community. So at this point in time, unless there's any questions, I'm done. Thank you.
Well, first, Vicki, I want to thank you. And Jimmy, did you just want to say closing remarks for Vicki, and then we need to move on?
I just want to thank you, Vicki, for the great work you're doing in our community and continue to do. Pienso que ya es hora, nuestro tiempo. So businesses, please stay. We're going to give you information on the Latino Civic Alliance this year because it's very important with the transportation dollars that are going to be injected into our economy. And como se digo, ya se llegó la hora de que estemos presentes y que seamos juntados. So thank you, Vicki, for the presentation today. Good information, and we'll continue to talk about the $2.5 trillion GDP we bring to the United States of America's Latino businesses. So muchas gracias. Thank you, Nina.
Thank you. Thank you, Jimmy. Thank you, Vicki.
Adios, ciao.
We'll now move to our next presenter, our final one before our special program starts at 11:55, where we'll have wonderful dances from the mariachi kids from Mount Vernon and also Governor Inslee and our keynote speaker, Senator Rebecca Saldana. But I'd like to introduce Sandra Rodarte. Sandra, we're having trouble seeing your face. There you go. Wonderful. Thank you for joining us, Sandra.
Thank you, Nina.
A little information about Sandra is that she is the program director with Latino Civic Alliance, the Achieve program. It's a social emotional learning program. And she has been with LCA for, gosh, it's been 5 years. Another thing that the Achieve program does, and she'll talk a little bit about this, but we are currently serving 4 school districts in Moses Lake, Federal Way, Mount Vernon, and Burien. Sandra's also the PTA president for Kylo Middle School and Federal Way. Sandra's passionate about working with parents and students achieving their dreams and empowering parents to help their children succeed. Welcome, Sandra.
Thank you, Nina. Buenas tardes a todos. I wanted to discuss a little bit about our program. We have the Achieve LCA program, which is a social emotional learning based program where we have our students engage in evidence-based social emotional learning and the curriculum, and they learn to find themselves and their culture and build confidence and resilience. We also try to empower our students by providing them with all these tools to succeed in life. Achieve is currently an after-school youth empowerment program with three course components intended to support each student individually and based on their current circumstances and needs. Along with student support, the program is intended to provide family and peer support to strengthen students and parental engagement in order to enhance the overall achievement of our students. The family support services that we currently provide, we do have a navigator who speaks with the family in their preferred language and is assigned to support the family every week and assess their needs throughout the entirety of the program. Parents will acquire communication tools, allowing them to establish a mutual dialogue and be involved with their children and create a balanced, healthy relationship. The Achieve program also partners with our local behavioral health programs to promote early mental health intervention and build strong families. And how do we do that? Students learn how to students learn to conflict resolution techniques to encourage healthier communication outcomes at school and at home. So currently we do provide these services as Nina mentioned, in 4 different school districts. We are currently in the Moses Lake, Burien, or Highline district. We are also in the Mount Vernon and in the Federal Way School District. And if parents who are out there and would like, for their children to participate, we encourage them to go and talk to their schools and their principals to see about providing the services in their schools, which we believe will help the student and parents become better and take part in their kids' education at this time. I don't know if there are any questions for us or.
I did. I wanted to jump in. If our consultants could add the, I guess the Achieve logo PowerPoint slide up, or Sandra, you can, but I just wanted to add everyone that's listening. The Achieve program, Latino Civic Alliance launched it 2 years ago, and it's doing tremendous, we're doing tremendous work. What makes it unique, as Sandra was mentioning though, is that we're not just working with the children, we're working with the family. So there's strong family engagement to make sure that the parents understand what their kids may be going through during the normal hours of their education plan. But it is an after school program, Achieve is, and so we're able to sort of incorporate our communication tools with the kids so that they can go home and sit down with their parents and be able to express themselves in a way that's healthy for them and for the parents to also learn communication tools that they can, as a family, be in a better place in regard to communication. We see that many barriers sometimes, and not in our community, is that communication can be challenging. It can create conflict, especially when one side doesn't understand the other. So Achieve has a strong emphasis on that. We also have a part of the curriculum is a College Beyond program where we're helping students, high school students, or 11th grade and 12th grade to apply for college and also to receive any grants that they may qualify for. Our navigators are also working with their parents and helping them, complete the applications for them to understand the application process that their kid is conducting and completing, but also the FAFSA, which can be very, very cumbersome and difficult to understand. So we're extremely excited about this program. We're expanding it, correct, Sandra? Right now, what other school districts are we looking at increasing the Achieve program into?
We're expanding hopefully to the Toppenish School District and into the Quincy School District. There is a question in the chat box about what grades we serve, and we serve from sixth grade to 12th grade at this time. And so we, have navigators that can address from the sixth, because it is different from 6th grade to the high schools. So we understand that there are the age group is different, but we have navigators that can serve both middle and high school children.
And I would like to add, Sandra, that part of the special part of our program is that we have partnered with behavioral health programs. In Burien alone, we have contracted and partnered with Catholic Community Services, their WISE program. It's a community-based behavioral health program. And so LCA, the Achieve navigators, instructors at times will refer students that may need support into the behavioral health program. They do the assessment, the intake. And what I love about this partnership is that it's a holistic approach, that once the child is involved in the program, the CCS WISE program clinicians and case managers will work with the parents and family for up to 18 months. So a lot of work. We know that during the pandemic, we had a lot of kids that were suffering with depression, still are. And so we want to do our part to help provide any additional supportive services we can to our kids that are part of the Achieve program, but in general. So right now we're looking at, right now we have a strong partnership in Burien. We're doing the same thing in Mount Vernon and Moses Lake. Anything else, Sandra, you want to say before we close?
We do have another question in the chat box. If we serve Clark County, we currently don't, but if you would like, for our services, we suggest contacting the school, and then they can get in contact with us so we can help the students there. Usually we have to build go through the steps in building that relationship so we can be part of your school. So we would be more than happy to be part of the Clark County School District there.
Yeah, or you can send us an email at info@latinocivicalliance.org, and we'll go ahead and as well, Sandra would make contact with the school district to see what the next steps are to get that moving. So thank you. Well, thank you, Sandra, for joining us today. And I think now we will move on to our special program. And I think we have the students ready, the Mount Vernon Mariachi.
We do. They'll be joining us shortly.
Wonderful.
All right, unmute myself. Hey guys, how we doing? We're
Great, great.
You can hear us.
Let's see the kids. Hi guys, how are you?
This is the Mount Vernon High School Mariachi and Folklorico. It is an honor for us to perform for us for the third year, I think, in a row. And thank you so much, the board, for inviting us, because one of our most important things, of course, is celebrating our music, our art, and our culture. And today I'm going to show you the youth that's continuing our music and music education and mariachi education for you. So we have a special song for you. This is, they're all high school students. We have about 200 students district-wide that are learning mariachi music. And we're the biggest program on the west side of this state. So here we go. Our first song is called Pelea de Gallos. I hope you enjoy. Here we go. 1, 2, 3, 1, 2, 3.
Van llegando los calientes con su gallo copetón y lo traen bajo del brazo al solar de la partida para jugarse hasta la vida con la que viene el color. Linda la feria de gallos con su público bravero, con sus chorros de dinero y los gritos del gritón. Retosando de gusto, con tequila y cantadores, no se sienten ni las horas que son puro corazón. ¡Ay, fiesta bonita! ¡Hasta la madrita! Con todas sus fuerzas. ¡Viva Aguascalientes! ¡Que viva! Que su feria son prima. Las apuestas ya casadas, las navajas amarradas, centelleando bajo el sol. Cuando suelten a los gallos, temblorosos de coraje, no hay ninguno que se raje para dar su nagarón. Con las plumas relucientes, brazos y cotazos, quieren hacerse pedazos, pues traen ganas de pelear, y en el choque cae el tiro. Solo el sangre la ha ganado el colorado.
Wonderful. Wonderful, wonderful. Well, we are waiting for our governor, Inslee, but if you have something
Okay.
else you'd like to perform, you may.
Mariachi, come forward, come forward, come forward. We'll do those for the others. Okay, here we go. Ready? All right. Ready? Okay, ready? 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 Ahí va. 1, 2, 3, 1, 2, 3.
Los barandales del puente se estremecen cuando pasó. Morena mía, dame un abrazo. Dame tu mano morena para subir a Chanía, que está cayendo la nieve fría. Si está cayendo, que caiga. Asómate a tu ventana, morena mía, huella de viajar. Si está cayendo, que caiga. Asómate a tu balcón, dame un besito de corazón. De todas a ti te quiero, de las demás no hago caso. Morena mía, dame un abrazo. Ya con esa me despido, entre perfumes y azares, aquí se acaban los barandales.
Yay!
Yes, that was wonderful, everyone, Ramon. And guess what? I see Governor Inslee's on.
Oh, yay, Governor Inslee.
Hola.
So I wanted to, Governor Inslee, are you on?
I am.
Well,
Can you hear
Governor,
me?
yes, I can. I just want to introduce you real quick so the kids can say hi to you too. Everyone, this is Governor Inslee, our wonderful governor leading our Washington state, and he's been in office, for those that are new, since 2013. Welcome, Governor.
Hello, hola. Buenas tardes.
You like the mariachi, right, Governor Inslee?
I'll tell you, everywhere you go, there's good music.
Yeah, I know. We're thank you so much for supporting the arts, Governor Inslee. I know you love the mariachi and you love the music, and we do this every year for you, Governor Inslee.
Well, I want this band to get the Grammys this year, for
Okay.
sure.
Why not? Why not?
I think they look good enough for me.
Thank
Now,
you.
are they going to any competitions this year?
Yeah, they're gonna be doing some contests in the spring. So are you gonna come with us?
Well, I don't know. Maybe I can get my grandson. He plays the trumpet a little bit. I'll send him instead of me.
Do it. Love that, Governor.
Well, thank you. Thank you, Mount Vernon. You guys are wonderful. Well, so welcome, Governor Inslee. The floor is yours. I'm so glad to see you and join us today.
Well, muchas gracias. I'm looking forward to this discussion. I think the highlight of this meeting was that music. So it's all downhill from here. But I am looking forward to this discussion. I wanted to report to you on some of the work our state's been doing to make this a more inclusive, equitable, and successful state. And the Latino community has just been such a pivotal part of this. You know, I think we got the greatest state in the country, and this community is a significant reason for that. And these young people that we just heard play give us more hope every time we get to hear them. So I want to launch on just kind of giving you a report of some of the work we've been doing in the state to maximize the Latino and Latinas communities destiny. First, I want to start is with our Office of Equity. You know, we've wanted to create an institution, if you will, to make sure that we embrace equity in all of the things we do in our state government. So we've started up this Office of Equity. They are in the first stage of their strategic plan. They're setting a real historic embedding of equity in everything across multiple agencies. And they're going to do that by collaborating across agencies to bring equity in everything we do. Now, this is on top of my pre-existing executive orders, which are calling for more supplier diversity in our contracting, to rescind the overly restrictive language against affirmative action. So we've taken executive action, but we want this Office of Equity to make sure all of our agencies are moving in this direction. I've also signed our poverty reduction executive order in December, and this is bringing multiple agencies to the fore to work together. This includes increasing public assistance benefits and closing gaps to access and improving, obviously, educational opportunities. And by the way, we're hoping all those band members can really think about staying in Washington State to be our teachers and our firefighters and our band leaders as well. And, you know, we're very proud. We actually have the best financial aid package in America for students who decide to go to college. And I hope everybody's given some consideration to that. So we're well on our way to taking the next steps forward in equity in general. But I want to talk, if I can, and for some more specific things we're working on. You know, one of the things last year that was very significant was a state Supreme Court decision that made sure that our dairy workers have access to overtime protections. And that has led to bipartisan legislation that created a phase-in for full overtime pay for agricultural workers by 2024. This is something I feel strongly about. It's something I've felt strongly about for a long, long time. It's some of the hardest working people in our state are working in the agricultural industry, and they deserve equity. I go way back on this. I remember voting for unemployment compensation for ag workers back in 1989. So we got to continue this cause for justice. And I'm glad that we're leading again. States, only a handful of states have this basic protection. I'm glad we're leading the country yet again. Now, our workers have additional challenges as well, including the climate change, and they're having to work in some real hot temperatures. You know, they got hit by this heat dome, and being outside during that heat was just so unhealthy. So we issued emergency labor protections last year to protect the health of agricultural workers from heat and smoke. And they continue to work on a permanent rule. So we have a permanent rule to protect these hardworking folks' health. Unfortunately, climate change, we know, is going to make these extreme events more frequent. So we want to respond to those realities, but we also want to make sure that everyone's fighting climate change. And I hope that this community is going to be vocal this year, actually, in the legislative session, to get the legislators to, in fact, pass more climate change legislation so we can reduce carbon pollution from Washington State and to do our share to reduce the threat of climate change. You know, we had people lose their lives because it was so hot last summer. Last summer in the Methow Valley, it was so smoky, it was the worst air quality anywhere on the planet. Think about that. In our state, we had the most dangerous air to breathe in the whole world because of the smoke from the wildfires. We know that we're losing salmon because the water is too hot. And so we need action against climate change. And I am hopeful that everyone on this call can share their views with legislators about this subject, because we have not yet done as much as we should be doing, even now, to fight climate change. So now's a good time to get to know your legislature. Let them know that it's already hot enough in the summer. We don't want it to get hotter. And I hope you can give the legislators some free advice about that. Now, I know we're all still very concerned about COVID. And we've been doing everything we can to help the Latino and Latina community against this scourge disease. We've tried to be as intentional as possible to make vaccines available to everyone. That's why we've had mobile clinics that have gone out wherever the Latino community is to make sure they have access to the vaccine. I went to actually the first one at a fruit processing facility up by Chelan. And we've tried to have as much equity in this vaccination requirement as possible. And we've appreciated the leadership of those who've worked with us, because we know that's where the real genius is right in the communities. So we've had millions of dollars we've put into Spanish language outreach. We've had leadership in the community to do outreach to their communities. As I've said, we've had these mobile vaccination clinics, and I'm glad we got a lot of people vaccinated, but we're not done yet. We're not done getting people boosted. And by the way, if you've had your 2 doses, I really hope you get boosted, because that booster significantly affects and increases your protection against this Omicron variant. And that variant's coming down. We've been really happy that the numbers are coming down. We're very happy about that, but there's still risk out there, as you know. Now, we also need better healthcare for the Latina community on top of COVID. Even if COVID wasn't around, we need folks who aren't documented to have healthcare. This is important to their families. It's important to the whole community. So I've included $4 million in my budget that will start the process of getting a more stable healthcare for folks who are undocumented. And I hope the legislature will help me in this regard. We've also distributed more than $120 million in economic assistance to folks to make sure that economically that people can keep their noses above water. And that's for immigrants who weren't eligible for federal payments. There's also another $340 million for immigrant relief that has been approved by the legislature that will be distributed as the State Economic Services Administration sets up its grant program. Our agencies like the Department of Commerce are working hard for small business grants as well, because we know the Latino community, some of the most ambitious entrepreneurs and small businesses. We want to make sure we can also get through this COVID pandemic. And I hope that we will, in the near future, get to a position where we can reduce some of the restrictions we've had so we can all return to a much more normal life. So I just wanted to give you a quick summary of some of the things we've been doing. I want to thank you for being active, talking to your legislators. By the way, they work for you. You're the boss, and you should feel free to share your opinions with them. Get to know them. I will tell you that you can make a real difference. You know, when you tell a story about your family and you tell them why a subject is important to you, take climate change. If that's important to you and you share that story with your legislator, it can move them. It really can. So I want to empower you to have those discussions. It can really help our state move forward. So with that, I want to thank you for being here. To all, mucha suerte, and I'll look forward to our next meeting.
Well, Governor, thank you so much for your leadership, and we'll stay in touch. And thank you for your advice. It's well taken. Thank you.
Thank you. Be well.
All right, Claudia, we've got a big news to announce, our keynote speaker.
Correct. We are honored to have Senator Rebecca Saldaña as a keynote speaker today. Senator Rebecca Saldaña, I'm just so proud to introduce you today. Senator Rebecca Saldaña is the Washington State Senate Deputy Majority Leader and represented 37 legislative districts. She's a proud Chicana and Mexican of Mexican and Germanic roots who grew up in the Del Ridge neighborhood of Seattle and has lived and worked primarily in Seattle and Oregon. During her tenure in the Senate, Rebecca has used her experience and expertise to spearhead legislative efforts to increase equity for historically oppressed communities, champion protect workers' rights, encourage sustainability development, build equity transportation solutions, and increase voter access to elections. Thank you, Senator Saldaña, for your services and for being here with us today. We are very proud of you as one of our representatives for the Chicano community. Welcome.
Yay.
Mil gracias, and thank you so much, Claudia. Thank you so much for the work that you have done for all of us, including my own family, in terms of being there to provide culturally competent, responsive care for our many folks that are suffering from mental illness, from substance use disorders, and from the fact that for too long we have not invested in prevention in the way that we need to. And we have not acknowledged that mental illness is and mental health well-being is healthcare. And I'm proud to be part of a legislature that is slowly trying to change that by making unprecedented investments in mental health and behavioral health, and recognizing that housing is healthcare too. And I look forward to working with CMAR, with Latino Community Alliance, with so many others that are here today to continue to push and build that kind of care that we need for our families. This is Black History Month. And so I think it's important that we take a moment to acknowledge that our own Latino cultures often fall short, and recognizing the racism that we bring from our own countries and that we end up inheriting when we arrived in this country or when we've been here always. And I want to take a moment to encourage all of us and to celebrate the rich contributions of the Afro-Latino community and our own continued and needed work to be able to acknowledge that Black lives matter, and that we need to be building relationships and building understanding with our Black Washingtonians and our Latino communities in every part of our state. I also want to take a moment to acknowledge that we are all joining together here, not just in these squares on Zoom, but with our feet on the lands. Where you're coming from, or where I am, is that we are standing on the First Peoples lands, whether it's Coast Salish, Yakima, or Colville, or the many other tribes and communities that are here, still alive and strong, and standing up with us for climate justice, for a Washington that works for everyone. I also want to call in our ancestors, those that have come before us, that have given us the strength and the opportunity to be here together today. And I want us all just to take a moment to acknowledge what Governor Inslee said, is that we are all still suffering under this pandemic. And this pandemic has laid bare the many kinds of inequities and challenges our communities have faced before this pandemic. So please join me in taking 3 breaths together. Inhale, courage. Exhale, fear. Inhale, courage. Exhale, fear. Inhale, exhale. There is a deep wisdom within our flesh if we can only come to our senses and feel it. And that is not my quote. It is a quote by Elizabeth A. Benke, but it recalls for me another quote that I also love to share always from Dolores Huerta, that the power is in your body and in our body. And it is in our coming together as individual bodies and to take collective action on this Latino Legislative Day that we have had huge significant impacts on this state, on our government, and in our communities. So thank you for continuing, even under these very difficult times, to bring us together. My focus as an organizer and as a state senator has always been centered around equity and justice for all, especially for immigrants and workers. I am proud of the progress we've made on many issues here in Washington. Well, I've been in the legislature, but there's so much more work to do to ensure our progressive policies that we've passed over the last several years are implemented properly and build towards really making lives better for all our people. Chief among these tasks is the imperative to protect voting rights and preserve and strengthen our democratic systems. In 2018, we passed the Washington Voting Rights Act. The VRA helps ensure that communities across the state have a fair chance to elect candidates of their choice. And we must continue to diligently fight to protect the right to vote and ensure that every person and every vote counts. And that's why this legislative session, I've introduced Senate Bill 5597 to further strengthen the VRA and provide even more protections and tools. By making the VRA easier to enforce, we can make great improvements in representation for communities of color across the state. And that is being heard in the Ways and Means right now. So hopefully they will move it out of committee. And so, because as we know, local democracy is strongest when everyone is involved and has an opportunity to have their voice heard. Washington has been and continues to be a national leader on this issue, especially with Congress failing to act to protect voting rights nationally. You're going to hear much more about this from speakers later today, and I'm especially honored to share the virtual stage with Dulce Gutierrez, who has been a tireless advocate for communities in East Yakima fighting for their voting rights. Justice and equity in our state means protecting our democracy and improving living and working conditions for all Washingtonians, regardless of race, economic means, or immigration status. And that's why I have sponsored legislation to support apprenticeship programs, including for culturally competent new programs for behavioral health and substance prevention professions, and why I have sponsored legislation to increase protections for workers. As we all know, this pandemic has shed light on the conditions many of our essential workers face every day, and the precarious economic position our families experience on the daily. Our communities have demanded that if our work is essential, our economy and state policy need to stop acting like our lives are expendable. As such, we need to be proactive as a state when it comes to dealing with work hazards and safety for all workers, especially those on the front lines. Last year, our biggest untold story was that we passed legislation to remove the racist law that prevented agricultural workers from earning overtime pay. This was only possible because of the brave dairy workers who took their cause all the way to the Washington State Supreme Court. And you may hear more about that from Chief Justice Stephen Gonzalez, who I see is here and is on the agenda shortly. I also want to thank the Washington Immigrant Solidarity Network's courageous advocacy. It was because of their fierceness that the governor established the Worker Relief Fund in the fall of 2020, and that it created the will for the Washington State Legislature then to fund the Worker Relief Fund for a total of nearly $400 million, and the next round of which is coming up soon. But as we know, we have to address the fundamental inequities of our systems. And that is why I'm proud to be the sponsor of Senate Bill 5438 to establish a first of its kind inclusive state wage insurance program that acknowledges the contributions that workers make to Washington, regardless of immigration status. This session, we had a historic hearing on a substitute amendment of that bill based on recommendations from the hard work done by community with the Employment Security Department and other agencies all throughout last year. So the program would mirror key benefits in our broader unemployment system while including specific privacy protections and programs design components for undocumented individuals. The bill provides opportunities for advocates and community members to continue partnering with the Employment Security Department during implementation and to ensure the feasibility, legality, and overall success of the program. While we did not get it advanced all the way through the process this year, I am committed, and I know you are too, to organize to make sure that we are updating our safety nets, like our employment insurance program, to work for all Washingtonians despite their employment status. There's so much more work that we need to do together, and it is with your continued partnership, with your care for yourselves and your communities, that we are going to push our state government to be more equitable and to be the government that is worthy of our children and our elders. Thank you so much.
Thank you, Senator
Wonderful.
Saldana. Thank you.
Wonderful, wonderful. Thank you for your leadership, Senator Saldana. We need you. All right, I think our next, I am honored to present our one and only Chief Justice Steve Gonzalez. It's such an honor for you to be in this role and leadership, Justice Gonzalez, so congratulations.
Thank you. Thank you. It's great to be here with you today. Wonderful to hear from the governor, from Senator Saldana. I see my good friend Javier Valdez, Representative Javier Valdez, also up on the screen above. And thank you to Nina and Claudia for helping organize this event. My grandfather, my late grandfather, wrote a poem. Soy el badajo de mi propia campana, doblando dignidad para todos. I am the tongue of my own bell, ringing dignity for all. That's what each of the students are. We've seen from Mount Vernon and the folks from across the state, advocating for laws that justly recognize their place in our society, that ask the governor to justly enforce and the executive branch to justly enforce those laws. And then, of course, bring cases to the Supreme Court, asking again for us to decide those cases, those controversies that can't be resolved outside of court. One of those cases was referenced earlier that had to do with overtime pay for dairy workers. We don't get to choose what lawsuits get filed, but we do have a say in what happens to them once they arrive here. And the only way that those decisions will go well is if there are advocates who are pushing for the lawmakers to pass just laws, and if we have executives who enforce those laws justly. Each branch of government is critical, and more critical are those of you who get to choose who we are. Our judges in the state are elected. I'm elected to this position. Everyone you've heard from the three branches of government, we are elected in this state. And whether you can vote or you can't, you can still influence those elections by being involved in campaigns and learning yourself about this critical process of civics in the state of Washington. So I'm on the Washington Supreme Court, the highest court in the state, and I am the Chief Justice of this court. I'm the first Latino ever to be the chief. I'm only the second Latino ever to serve on the state Supreme Court. My mentor and predecessor, Charles Z. Smith, was the first, and he was Black and Latino. The second Latina, the first Latina, but third Latino on the court is Justice Mary Yu, and she and I serve on the court now together. We have the most diverse Supreme Court in the nation. I'm joined, well, on our court, there are 7 women and 2 men. There is 1 Native American woman on the court, a Black woman on the court, and an Asian woman on the court. We work together well. Of course, we don't always agree, but it's wonderful to have that variety of background and position represented here. And I want to take a moment and say something about our need to understand and reach out to others. I know that it is also historic in the legislative branch in terms of representation by women from Asia with Asian roots or Asian background. And sometimes this is confusing for people who don't know that community. Recently, a television station confused Manka Dhingra and Mona Das. I guess their initials are both MD, but they're 2 bright leaders. And I want to mention a few of the leaders in our legislative branch from South Asia who are women, who are bright and strong and hardworking. I had the privilege to swear in Yasmin Trudeau, who's a Bengali American, to her position from the 27th in the Senate. Also Representative Vandana Slater from the 48th. And as I mentioned before, Senator Mona Das from the 47th in Kent. She's from India originally, an immigrant at 8 months old. She is a leader and an entrepreneur. The person she was confused with is Senator Manka Dhingra, an attorney who used to appear before me back when I was a Superior Court judge from the 45th in Redmond. She is the first Sikh legislator in the nation. Again, these leaders are people that we in the Latino community should make sure that we're familiar with, that we reach out and understand them, and help them understand our issues as we learn about theirs. It's a privilege to be here with all of you today. I appreciate again the invitation and look forward to when we can see each other in person. Muchas gracias.
Thank you, Chief Justice Gonzalez. Wonderful. Thank you for joining us. Claudia?
Yes, thank you, Chief Gonzalez. We are moving to our next presentation. We are proud to introduce Representative Lillian Ortiz Self. Lillian is a wonderful representative for the Latino community and an incredible close friend of mine who I'm just very proud to introduce. Lillian worked across child serving systems, give her a deep appreciation and understanding for all human services. Her professional background includes serving as a clinical director of the Tri-Cities Mental Health Center in Missouri, regional coordinator for the Illinois State Board of Education, education advisor of the Department of Children and Family Services, and director and founder of the Comunidad Unida Project, a center for the Latino families of youth. She has represented the 21 legislative districts since 2013, and she's a member of the leadership team serving a majority caucus chair. Thank you, Representative Lillian Ortiz, for everything you've done for the community, and welcome.
Thank you so much, Claudia. Es un placer estar aquí con todos ustedes. Great to see all of you. I really appreciate the opportunity to bring some greetings. I just want to say that the work that you're doing, that LCA and all of you advocating and using your voices is what makes a true difference here. It's what makes a difference with every one of us. So thank you so much for being willing to do so. You know, as I look at what we have ahead of us and coming into this session and others, there's always the sense that we have to make every system work for us. As I look at this session and I look at things like what's happening with L&I and wanting to make sure that we do policies around ergonomics. I co-sponsored a bill on ergonomics for that would allow janitors and people that clean and restaurant workers that do repetitive motion, get ergonomic studies to be able to protect them on how to best do their jobs. You know, everyone else has them. I can have that study sitting at a desk, but those that lift and scrub our floors are included in those kinds of decisions. I also have a farm workers audit bill to look at how was L&I able to handle the needs of our farm working community, our most essential community in the state of Washington, and how effective and what do they need to move forward. Those are things that are critical. In education, we have bills around making sure that we fund our most vulnerable children, that those with English language learner needs are being taken care of during this pandemic, that we have nurses in there to be able to take care of those that get sick. In mental health and behavioral health and substance abuse, those are critical issues in our communities right now. So across the board in every system, we have to continue to advocate to make sure that the needs of our community are met and that equity and justice is served for every Washingtonian. And that's what I believe in. I know that's what you believe in. And every time you use your voice, you are standing on the shoulders of your family members that came before you and other members that continue to get us to the place that we are today. So I thank each and every one of you. My plea to you is to continue to use your voice for those who have a hard time or can't, and for our communities, and more importantly, for our children. So thank you to each and every one of you, and thank you for the opportunity to be able to bring greetings. Estoy aquí a la orden.
Thank you, Representative Ortiz. Thank you for being here today. We are moving to the presenting Representative Javier Valdez. Representative Javier Valdez is a member of the Washington House of Representatives, representing the 46th Legislative District. Representative Valdez is a proud son and grandson of farm workers and laborers, a product of public education, Representative Valdez holds a bachelor's degree in business administration from the University of Washington and a master's degree in public administration from Baruch College, the City University of New York, as a participant in the National Urban Fellows Program. Thank you for being here today.
Thank you, and buenas tardes, everyone. Yeah, Javier Valdez from, and I represent the 46th Legislative District, which is Northeast Seattle, Lake Forest Park, and Kenmore. And thank you for the invitation to be here today. Thank you to the Latino Civic Alliance, Nina and Claudia, for all the work that you do, not only here locally, but throughout, for all of our communities throughout Washington State. And I also want to, of course, thank my dear friends, Senator Rebecca Saldana, Justice Steve Gonzalez, Representative Lillian Ortiz-Self for your words today. And I want to congratulate today's awards winners, Dulce Gutierrez and Pedro, for your acknowledgement later today. You know, usually when I speak here annually, I talk about, you know, some of the bills that I'm working on, some of the policy areas. But I thought today, I think I want to be just a little bit more personal. So I'm first generation. You know, both my parents were from Nuevo León in Mexico. But I was born and raised in Eastern Washington in Moses Lake. And, you know, as was said in my introduction, you know, my parents and grandparents were farm workers and laborers. And when I came to the legislature in 2017, it was hard to believe that I was actually the first Latino who was ever born and raised in Eastern Washington to ever make it to the legislature. You know, yes, I represent a Seattle district, but I also think it's my responsibility to ensure that I'm representing and supporting all of our Latinos in Washington State. Part of my civic duty. As you know, and especially for those, of course, who are working in those extremely hard and tough working conditions. You know, those from our communities who are working in our fields and our farms. And you know, here in the legislature, you know, someday, you know, we win some, you know, and we lose some. But we fight every day, I think, to make good policy. And I thought today I would actually share a picture. I don't know if you can see it very well, but this is a picture of my pop. I'm trying to do a better job of getting it up on the screen. And this picture was taken of him in 1965, working in Moses Lake at the UNI sugar factory. And this was actually his first job where he was not working either for a farmer or not working in the fields. You know, was, I guess, more of a regular, 8-hour working day, but it was his first job working, not in the fields as a farm worker, but and here he's actually demonstrating how you make sugar at the Moses Lake factory. And when I look at this picture, I have this picture actually both in my office in Olympia, but also in my district office here in Seattle. And when I'm having a bad day, or maybe things just aren't going well on some of the bills I'm working on, or whatever reason, I look at the picture. And he worked hard to ensure that I would be able to go to school. And it's because of that, I'm here today in Olympia. We're serving in the legislature, and if he can work under very tough conditions his whole life, he's not with us anymore, but if he can work under such tough conditions to make sacrifices for his family, then that's when I look at that picture, that's what motivates me to ensure that I'm doing my best to ensure that current generations and future generations, first generation, but also folks who look like me have those opportunities that he didn't have. And so that's what I try to do here every day when I'm in the legislature. So thank you for the opportunity to be here today, and thank you again for all that you do for our communities.
Thank you, Representative Valdez. Thank you for your service. You've been a wonderful leader addressing hate crimes too in Washington State. So thank you. I'd like to now move on to our 2022 Latino Civic Awards for amazing and heroic leaders in Washington State. We normally choose leaders based on the following. We recognize individuals or organizations in the state of Washington have gone beyond the call of duty, often at a tremendous personal sacrifice to improve, inspire, and protect the rights of the Latino community. We are recognizing today two excellent leaders. First is Dulce Gutierrez. She is receiving the award for excellence, commitment to excellence for significant contribution in her advocacy to protect voting rights in Washington State in recognition of dedicated service to others as substantial in perseverance, integrity, and time commitment. Congratulations, Dulce. We're proud of you.
Hi, happy Latino Legislative Day. Thank you, Latino Civic Alliance, for this Civics Award. It's a tremendous honor to be recognized by your organization on this very important day. Voting rights advocacy is important for everyone in this country, but in the state of Washington, it's Latinos who have been at the center of the fight for voting rights. So in accepting this award, I want to acknowledge all the elders that came before me who did so much to advance the voting rights and representation of Latinos, especially in Yakima. Thank you so much, because just 10 years ago, Latinos didn't have a way to even get onto the Yakima City Council. And now we see Latinos on city councils across the state, in Burien, in Mount Vernon, in Pasco, Wenatchee, Seattle, and a bunch of other places. And that number is only going to continue to grow. So while we have a lot of work to do, we also have a lot to celebrate. And I want to thank everybody who continues to put in work every single day across our communities of Washington to advance voting rights and representation for disenfranchised communities. I also want to encourage you to challenge any level of government that has institutional barriers preventing our community from having real representation. We must hold the government accountable for excluding the Latino community from having real representation each and every time we see that happening. Also, vote every single year, run for office, and support candidates that share your values. We have so many bright minds and hearts full of compassion that when we unite, nothing can stop us. So keep raising your voices and lifting up our community needs, porque la lucha sigue. Thank you. Gracias.
Excellent.
Hi,
Congratulations,
happy Latino Legislative
Dulce.
Day.
Excellent. Thank you, Dulce, for your leadership. Our next recipient is Pedro Espinosa. He's receiving the award for commitment to advocacy for significant contributions in his leadership during the COVID-19 pandemic to protect labor rights in recognition of to serve others that is substantial in perseverance, integrity, heroic, and time commitment. Pedro, we are honored to recognize you today for your incredible work in the community. Thank you so much for all your hard work.
Thank you, Nina. I truly am humbled. I don't know if you could see this. It's kind of, the camera is not allowed. Oh, there we go. So anyway, I just want to thank you guys for this award. I am truly humbled, for Latino Civic Alliance to recognize me. I'm just a labor guy. But I feel that labor in our communities are very important nowadays, especially with what happened with the pandemic. It exposed a lot of the things that were already there that we as a people knew in our communities we were suffering. We were getting left behind. And I think right now that labor is more important for us to be embedded into our communities, as they are a gateway and an opportunity for a career for some of our people. And I think that opening those opportunities will only lead to progress our communities and make them better. And again, I'm truly humbled for this is the work that I've been doing for my entire life. I think it's just a little, a recognition, but again, it's, I just can't say how much I am humbled to get this award. I am going to leave with a quote though, that I think represents what it means for us in labor. It says, labor movement is the principal force that transformed misery and despair into hope and progress. El movimiento obrero fue la fuerza principal que transformó la miseria y el desesperanza en esperanza y progreso. Otra vez, muchas gracias por esta oportunidad y la oportunidad a la latina comunidad que tenemos allá. Gracias. Thank you, Nina.
Congratulations, Pedro. Congratulations again to our 2022 Latino Civic Awardee and recipients. And now I know we're running a little behind, but we are almost, the event ends at 2 o'clock. And now we're going to have some great presentations. And our next panelist is the Washington Coalition for Police Accountability. Welcome, Sonia and Marilyn. And I believe we have someone from ACLU representing, Roxana Garcia. Excellent. A little bit about the coalition. It centers around families and communities impacted by police violence. Members include families who have lost loved ones to police use of deadly force. I-940, if all of you remember, initiative, campaign leaders, civil rights organizations, tribes, labor union, the faith community, and activists committed to ending the violence present in police culture and practices. Their beliefs are to hold police accountable and power over life and death. They believe in de-escalating crises rather than escalating them, and they believe they can treat those that suspect of committing crimes with dignity, stabilize dangerous situations safely and humanely. That every life is sacred and police must be held accountable for unnecessary violence. So welcome everyone for joining us today. And just a quick introduction: Sonia Joseph, Marilyn Covarrubias, and then Roxana. So Sonia, I believe you're the moderator or the of this panel. You'll take the lead.
Thank you so much for having us here. Today, we're just going to educate folks on the legislation last year that was passed on 4 police accountability bills. And I'll go ahead and pass it to Roxana.
Hi, good morning. Buenos dias. My name is Roxana Gomez. I'm a lobbyist with the ACLU of Washington and also with the Coalition for Police Accountability. I'll pass it to Marilyn. Thank you.
Okay. House Bill 2037 rolls back legislation and reverses accountability laws that were enacted in 2021 that address police use of force and physical violence, and people shouldn't be suspect to or subjected to being stopped while driving a nice car, walking in a nice neighborhood, walking into their own yard. These things happen to people of color every day. 1788 strips away reforms concerning car chases and vehicle pursuits. Takes away safeties that impact kids, young people, communities of color, Black and brown, and disproportionately impacts people of color. Policing will hurt. This kind of policing will hurt communities. Last year, after legislation passed, sorry, that's why I couldn't see. 14 bills addressing police reform. Washington State had 60% reduction of people being killed by police, the largest since data started being collected in 2000, and the largest decline of any state last year. Physical force is at the core of these bills. It's an effort to lower the standard as to when physical force can be used from probable cause to reasonable suspicion. The truth is, there was already laws that allowed police officers to use physical force when there was an imminent threat of bodily harm or when there was a probable cause to arrest. Now, however, officers can or will be able to use force on someone who flees, even on very little evidence connecting them to wrongdoing. And it doesn't take into consideration why someone would flee. Kids flee. They watch the news, they see what's happening, they see police brutality. It's a natural instinct, and especially people who have on other occasions been stopped for no reason other than the color of their skin. My son, Daniel Covarrubias, this is case in point. My son, Daniel Covarrubias, didn't run. He wasn't armed. He had done nothing wrong, but he was murdered anyway. He made the mistake of thinking that these things made him safe. Some people run when they are scared. It's totally understandable. Why wouldn't they? Hello?
Thank you so much, Marilyn. I'm going to go ahead and talk about House Bill 1054, which is the police tactics, which we passed last year, and it addresses the ban of all chokeholds and neck restraints. It prohibits the use of police dogs to arrest or apprehend a person. It bans tear gas, prohibits the use of certain military equipment, and prohibits no-knock warrants, and it restricts hot pursuits and shooting at moving vehicles.
I didn't understand
that. So by passing that, it restricted all of what I just read. And another bill that was passed was 1310. And 1310, it was to adopt a statewide de-escalation standard and the duty of care, so that officers could use reasonable care in determining whether and when to use physical force, and to call for backup and crisis intervention, or walking away when there is no crime being committed. There were 13, over Washington State, there were 300 policies of use of force, and what 1310 did was changed it and made it into one policy that every police department can follow. And I'll go ahead and pass it to Roxana.
Sure. So I'm going to talk about 5051. So Senate Bill 5051 was passed last session. It was also known as the decertification bill. And it basically addressed serious misconduct, police misconduct, by expanding the eligibility and the reasons for when the Criminal Justice Training Commission, which is the entity that provides these licenses, to take away those licenses. The problem that the coalition was trying to solve is of law enforcement officers who have committed offenses or committed serious misconduct in one department. And rather than accepting or dealing with the consequences, they moved on to other police departments. We saw this in a variety of different ways. And we wanted to make sure that people, where there were issues in one department, it just wasn't, they weren't just moving on to another department to avoid that accountability. So what 5051 did, for one, it changed the composition of the Criminal Justice Training Commission. And now I'm proud to report what we've seen out of the Criminal Justice Training Commission is that it is now 51% composed of non-law enforcement officers. So people from the community, including our very own Sonia Joseph. She is a commissioner with the Criminal Justice Training Commission. We've also seen that the decertification process is now very robust, with mandatory decertification for serious misconduct. So that means that, you know, again, these issues are seriously being taken into consideration by the entity that provides and creates licenses for law enforcement. And another, I think, critical important component of this is that complaints can now be made directly to the CJTC about an officer's misconduct. Whereas before it had to be taken through the department level and eventually reach its way up to the CJTC. But now any civilian, if they see something, they should say something. They should email or reach out to the CJTC about misconduct that they're seeing in their community, so that it can be taken seriously and addressed by the Criminal Justice Training Commission. I'm gonna pass it to Marilyn to talk about House Bill 1267, the Criminal Investigations Bill.
Yeah, we believe that it's not possible for police to investigate other police and remain impartial. They interview witnesses, collect evidence, new video, examine blood splatter and ballistics, prepare results, and make recommendations. Colleagues simply cannot investigate colleagues. Police cannot investigate police. The investigations into crime of assault or a homicide cannot be half-hearted and must be rigorously and of high forensic quality. The existing 940 system is not satisfactory because because of the investigations, while being outsourced to neighboring jurisdictions, are not far enough removed from the law enforcement community itself. Even the most careful investigation done in good faith and compliance with 940 is going to fall short because of the immense difficulty in investigating a colleague. The mitigations in the I-940 WAC cannot fully inoculate against bias and the challenges of being completely impartial. This litigation establishes an office within the governor's office for criminal investigations of injuries or deaths from police use of force, requires hiring a director who has experience in conducting criminal investigations or prosecutions, states that the director and staff must do their work using an anti-racist lens, requires investigations by completing the 120 days of acceptance of the case, sets out that the new entity must plan to transition to investigators who are non-law enforcement within 5 years, provides authority for the new entity to investigate cases that occurred prior to the establishment of the office. There is providing there is new evidence since the initial investigations, adds an advisory board to the governance of the entity and the majority of law non-enforcement, with tasks including hiring, putting input for the director and whether to expand the scope of the office. We believe the statewide independent office will provide the necessary separation and impartiality to provide fair processes and just outcomes. They are now organizing to create this office where all cases will be independently investigated. The WCPA believes that life is sacred. We believe in the dignity and rights of all people. These experiences point to an urgent, needed fix to a system that accepts the continued loss of life. Second, our work involves being forward the truth. And these are the experiences of families that are that have informed and shaped the policies. Please allow follow WCPA for more information and what's happening in legislation. I just want to thank everyone for listening to me, even though I was kind of
You're wonderful,
discombobulated.
Wonderful, Mary. You're wonderful. Sonia, is that conclude, or did you?
Well, go ahead and follow. You guys can follow us. We have a Facebook. We have Washington Coalition for Police Accountability.com. And thank you.
I wanted to just close by saying, for those that are watching today, the impact. We have a mother, Sonia Joseph, her son, Giovanni, and Marilyn Corubias, her son, Daniel, and the incredible work they have done, even though they lost their beautiful sons to police violence. And I've worked with them, had the honor to work with them over these years with police reform, but to see that from something that was of tragedy, and for their perseverance and continued commitment to work through these years to finally change laws. If you all are not aware, Washington State has passed incredible legislation for police reform. We've done amazing work, but it's because of mothers, Sonia and Marilyn, that took the leadership and made this happen. I just want to tell you how much respect I have for you. It's been an honor working with the two of you. And thank you, Roxana, for joining us today.
Thank you.
Thank you. Thank you. And we will move on to our next presenter, which is Attorney General Bob Ferguson.
Yes.
Here. Okay, it's Claudia, it's yours.
Yes, I think Attorney Bob is here.
Yes,
So I
he
had-
is.
Thank you, Nina. I had the pleasure to introduce an Attorney General Bob Ferguson. He is going to be addressing the high capacity magazine sales ban in Washington State. This is the SB 5079 HB 1104. He's also going to be talking a little bit about affordable hospital care, charity care, which is the HB 1616. And we also want to have a little bit of time to address the danger of youth in having access to firearms. As a short introduction, I know I could spend hours introducing our Attorney General, but our Attorney General, Bob Ferguson, is a Washington State 18 Attorney General. As the state chief legal officer, Bob is committed to protect the people of Washington against powerful interests that don't play by the rules. He is the fourth generation Washingtonian, a graduate from the University of Washington and New York University Law School. Bob and his wife, Colleen, are the proud parents of teenage twins, Jake and Katie. Thank you for being here today. Welcome.
Oh, thank you so much for that kind introduction. It's great to see you and great to see all of you virtually, of course. I hope you're all staying healthy and have got your boosters. I got COVID during the holidays, and our whole family did. And I had a pretty rough, it was pretty bad for about a month. And I had not gotten my booster. I had it scheduled and then couldn't go because of work and did not get it rescheduled. So my wife was boosted and she was just fine with symptoms. I did not, and I was not boosted. I really, it was bad. So if you haven't had a chance to get boosted, I encourage you to do so. Thankfully, I'm feeling a lot better now, which is great. Although I do miss the chance to have this conversation in person. Of course, rallying down there on the steps in front of the Capitol. I always look forward to it every year, the great turnout, seeing so many friends. And also, I know we've had in the past, Nina, I see you on as well, and others who we've met in my office before, of course, to talk about issues, which I know is wonderful, not just for me, but for my entire team who joins me, the leadership of my office. So once we get through this pandemic, I'm looking forward to having those conversations in person again. So I'll keep this relatively short. I know you all have a tight agenda, but I will touch on the issues you mentioned briefly, and then happy to answer a few questions if you have them. And so, it's been a busy time in our office. As you know, in past gatherings with this group, I've mentioned litigation we had protecting Dreamers. That case went all the way up to the U.S. Supreme Court, where Washington State won. Was really very proud to work on that case. We've been very active in making sure that farm workers' rights are protected. We've had to file more than one lawsuit related to sexual harassment of farm workers in Washington State, and have had some really outstanding results in those to get resolutions that, while you can never make those individuals whole for the harm that was caused to them, but to provide compensation for them and some accountability that is important. And so one thing I just want to say at the outset is that whether it's a consumer protection issue, whether it's a civil rights issue, whatever the issue might be, feel free to contact my office if you have a concern or a complaint. My team is excellent. I created a civil rights division that handles much of that litigation, for example, to make sure that farm workers are treated fairly. But if you hear something, you see something, that's how most of our cases get started, is hearing from folks in the community. And so that's important. And I just want to emphasize, when somebody calls, we have also Spanish-speaking individuals and investigators and attorneys who can discuss issues with you. You can assure anyone you know, if they call our office, we do not ask about immigration status. We are not focused on that. We're focused on making sure that all Washingtonians are protected under law, because every Washingtonian has the right to be protected under all of our laws, whether one is documented or not. And so just really encourage you or anyone you know to contact our office, and we want to hear what's on your mind. So moving maybe to a couple of the issues that you mentioned, if that's okay. As Attorney General, well, I'm not a legislator, of course, right? I don't get a vote on these bills. I don't control the budget. I wish I did, but I don't. But as Attorney General, I still can have a role with the state legislature and the legislative process through proposing bills. So just like the governor can propose a bill that goes through the legislative process, as Attorney General, I can do that as well. So in every legislative session, I'll have anywhere from a half dozen to 10 bills that we draft from my office, that we propose to the legislature. It has to go through the normal legislative process, just like any other bill does, pass the House, pass the Senate, be signed by the governor. but legislators know it's coming from my office. It's AG request legislation. And one of those you referred to in your introduction, which is related to, this epidemic of gun violence that is going on and issues related to public safety, and whether it's walking down the street, whether it's your kids like my kids who are in this classroom right now, to make sure that we have safe communities for everybody in our state is obviously extremely important. And, over the years, I've proposed different bills that I think get to what I would consider to be common sense gun reform that have been passed in other states, but not yet passed in Washington state. And so the one you mentioned does relate to what's called high capacity magazines. And what that means is you often will read about a mass shooting around the country. There was one in Dayton, for example, a couple of years ago, in which the shooter in Dayton killed and injured about 35 people in about 37 seconds. And before law enforcement, thank God, was there on the scene to stop the shooter. Well, how is it possible to shoot that many rounds in half a minute and kill and murder and injure that many people? Well, this individual had what's called a double drum high capacity magazine. It holds 100 rounds, which means that individual did not need to stop to reload their weapon until they had fired 100 rounds from their weapon. You often read about mass shootings where people get away or stop the shooter when the shooter has to stop to reload their weapon. That gives folks precious seconds to escape or to tackle the individual. Well, if you have a double drum magazine with 100 rounds, guess what? You don't have to stop, right? And so in Washington state, it may seem hard to believe, but in Washington state, that double drum high capacity magazine is perfectly legal. You can go into a store and buy it today. And even though a number of states have outlawed those high capacity magazines, and courts have upheld those are constitutional limits. And so I proposed banning high capacity magazines. Now, I support the Second Amendment. People have the right to bear arms for protection for any number of reasons. But what states have done is limited those high capacity magazines to 10 rounds, which is certainly sufficient for self-protection or other appropriate uses. So one can support the Second Amendment and still place limits on firearms, just like First Amendment rights. We all have the freedom of speech. We love that, but you cannot shout fire in a crowded theater. That's against the law. That's not speech. You are jeopardizing people's safety. It's the same with gun laws. So I've proposed this bill again. My great friend, Javier Valdez, who's actually my representative here in the 46th district, where I'm zooming in from, my home in the 46th district. He's my representative, is the prime sponsor, as many of you probably know, and I think he may have spoken to you already today. Javier is the prime sponsor of the bill in the House, and on the Senate side, it's Senator Marco Lias. And so, we're just working this bill as hard as we can. Anything you can do to assist in that effort, obviously we would appreciate it, but I think this is the 5th or 6th year I proposed it. And we're hoping this is the year to finally get it across the finish line. And last thing I'll say is, importantly, every federal court of appeals court across the country has upheld these as constitutional, and the U.S. Supreme Court has allowed them to stand. So these are constitutional provisions, and I'm just asking the state legislature to take a vote in the House and the Senate, because I think it'll pass. The votes are there if we can get there on the floor of the House and the Senate. And maybe the other bill I'll speak about just briefly, then I want to make sure we leave plenty of time for questions. Relates to what you mentioned, relates to access to healthcare and affordable healthcare. And what this issue goes to is that, Washington, like other states, has what's called a charity care law when it comes to healthcare costs. And it's just a word for financial assistance. And this can be for someone who's uninsured and gets a big medical bill, or for folks who are insured, but those out-of-pocket expenses, even if you're insured, can be very, very high. And if you are someone who, for example, is making a minimum wage job, you're working hard, you're playing by the rules, but you have a medical situation come up and you're insured, but you've got out-of-pocket expenses, that can send you and your family into a financial crisis. And it is well documented that medical debt is a primary driver of bankruptcy and medical crises in families all across our country and right here in Washington state. So I mention that because we have a law in Washington state that says, if you qualify, if you're at a certain level of the federal poverty level, you qualify for financial assistance if you have those costs, which makes sense. Well, guess what the bad news is? Let's say you are a single parent and you work 2 minimum wage jobs and you work 50 hours a week. My guess is you're pretty busy and you're working hard to provide for your family. Well, if you have a medical crisis in your family with your child or yourself and you have those out-of-pocket expenses, guess what? our charity care law in Washington state does not help you. Even though you're a single parent working 2 minimum wage jobs and 50 hours a week. In Oregon, if you're that person in Oregon, guess what? They waive those expenses, but not here in Washington state. In a way, what's even worse is for some hospitals in Washington state, they do help you out, but others do not. In other words, there's not a uniform system. And so part of it depends on geography. If you happen to be in an area where a hospital provides that to you, great. But if you're next door in an adjacent city, you may not get that. That also seems fundamentally unfair to me. So I have a proposal to the state legislature to change that, to line us up more with Oregon, which would increase dramatically the number of Washingtonians who would benefit from this financial assistance of their medical debt. And again, this can be when you are insured, those out-of-pocket costs, which I suspect many of you are familiar with, can be very expensive. The good news on this bill, it's had bipartisan support. It passed the House just today's Monday. I'm losing track of the day. Today's Monday, right? So last week it passed the House 63-33, if I remember correctly. And now it's moving over to the Senate. So this bill really could be transformative for so many Washingtonians on a really critical issue, and encourage you to check this bill out. Tara Simmons is the prime sponsor of this legislation. In fact, she comes at it from personal experience of one of her children who went through this experience. And we've been working together on this, and we think it's a great bill. So I'm going to stop there, just make sure that that I keep on schedule and don't go over my time, and to make sure there's time to answer a question or two or three or whatever you folks have. So again, it's great to see you all. I just so appreciate the chance to say hello, and hope to really see you all in person sometime soon.
Well, thank you. Thank you for your overview. We have right now 148 participants, and many of those are using the language translation. So it's wonderful.
Wonderful.
Yeah, we have a whole treatment center of youth who are right now streaming and being able to hear your presentation. So because of that, I want to ask you a question related to youth. We are concerned, the Latino population, about the amount of young youth who are getting access to guns, either because they're at home, either because they got it from a friend. So we wonder what type of preventive programs, any kind of preventive program that you are advocating for, or the state is involved in, to prevent the youth to get access to guns.
Yeah, thanks so much for that important question. As a parent of 13-year-old twins, right, I, like many of you, care about the access that youth have to weapons that they should not. A couple things. So number one is, I actually proposed a bill where that eventually came into law through the initiative process, but in Washington state, up until just a couple of years ago, you had to be 21 to buy a handgun, but only 18 years old to buy an assault weapon, an AR-15, which made absolutely no sense to me. I proposed changing that law to make it 21 for both types of weapons. The legislature did not pass it, but thankfully there was an initiative process, and citizens got together and went to the voters, and the voters overwhelmingly approved it. So to whoever's asking that question, I agree with the sentiment of, hey, making our laws sensible and doing everything we can to keep it out of the hands of young people. We've had tragedies here in Washington state where a teenager purchased an AR-15 legally and killed and injured numerous of his classmates in a shooting in Mukilteo a few years ago, as one example. Number two, this gets really more into the legislature's role, right? Of funding that they can provide for education, right? For work that can be done to address this issue. I think Manka Dhingra, if I recall correctly, Senator Dhingra had a bill, I think it was in the last year of session, that was related to firearm violence intervention that passed the legislature. I supported that, and my office supported that legislation. So we look for opportunities to support legislation like that provides funding for that type of outreach, the education, the prevention, all those things that are so critical. And so that said, we also look forward to any ideas any of you have on what more my office can do. What I'll say is that this is an area that I'm very active in, as I suspect you can tell, proposing legislation, fighting for changes, supporting folks like Senator Dhingra on efforts they've made as well, and just really welcome any input that you have, because just speaking as a parent, more than as an attorney general right now, but speaking as a parent, it's an issue that worries me deeply on a personal level, and I know it impacts communities all across our state.
Yeah, we were thinking, as part of the Latino Civic Alliance and the partners of other organizations that work with Latino Civic Alliance, is the need to include community voices. the outreach to community and really getting to understand what the community needs. A lot of the times what we're seeing, a lot of the bills who names Latino people, right? This is all like Latino ones, really has not included our communities. So really bringing together panelists or bringing a group, you had done that in the past with some of your other efforts. It's just making sure that we have enough representation, and the Latino Civic Alliance could be a good leader in terms of being involved in an effort like this.
Absolutely. And we, I mean, as I hope you all know, right, we really enjoy working with all of you, have working on many different areas, and welcome those communications. I will say it's worth pointing out that historically, the Office of the Attorney General has not done an especially good job of reaching out to communities across our state. That's an unfortunate reality. Before I was Attorney General, if you called our office with a civil rights complaint, we referred you somewhere else. And we have like 700 lawyers in our office. We didn't even do that work at all. I've created a civil rights team to do that work. And as an example, a big part of their mission is reaching out to communities all across the state, because hearing from folks across the community is what educates us and gives us ideas about where the litigation, where our impact from the litigation standpoint can make the biggest difference. So whether it's public safety, civil rights enforcement, consumer protection, you name it, we welcome the interaction, always be happy to sit down with any number of you to talk about any issues that might be on your mind. So thanks for mentioning that.
Yes, we have, I'm sure there will be more questions from all the participants. They could type your questions in the chat, and I'd be happy to share those with Attorney General. One of the other questions that had come up is regarding the Latinos who right now are paying very high bills for COVID testing. I know you had been really working hard to make sure that standardize some of the prices and there is no gouging in terms of how much we get charged. But some of the reports that we're hearing from Latinos is that after they go for a test that appears to be free, they receive a bill for $150 or more. So they wonder what they could do in those cases.
Sure, thanks for that. A couple of thoughts. So this touches on a part of our work that we refer to as our consumer protection. And so we have a Consumer Protection Act. It's a law that's been around for a long, long time. And what it says is you cannot engage in unfair or deceptive business practice, unfair or deceptive. And so we have a large team that enforces that. And almost all of the cases that we bring, almost all of the investigations we start come from a Washingtonian writing or calling our office with a complaint. And so we receive about 24,000 complaints a year. So that's a high volume. And we go through those and then begin investigations as appropriate. And we do have some limited resources. There are some limitations on that. That said, on issues related to COVID, we've been very active on whether it's price gouging or misrepresentations by businesses of medical treatments. You name it, that's been an area we've been very active in. And so, those are things that we're interested in, that we would follow up on, and just would encourage anyone to write to our office. You can go to our website, the Office of the Attorney General website, atg.wa.gov, atg.wa.gov. And there's a form there just to type in. And those are all those are reviewed by my team. And that's the best way to reach our office. Again, one thing I'll also add is that if folks want to meet with members of the team about a specific concern, we can also arrange for those conversations as well, if that's helpful, especially if communities see a systemic type of problem that's impacting their community. That's the type of thing that we're more than happy my team can sit down or take a phone call or whatever makes the most sense. So that issue that's raising that question, that is the kind of thing that my office can, right, if there's something unlawful going on, can have a role in it. Yes.
So Bob, Clive, it's okay to jump in. This part of the question too is what we're hearing is these corporate companies are coming from California. They're not from our state. So what they're doing is they're setting up a vaccination site, and you would think it's confusing because you would think that it's a King County or it's a local jurisdiction public health free clinic. And what's happened is our community members go in there and they take they're asked if they have insurance. Most of the time our community is confused. Why are they being asked for insurance? Because it's supposed to be a free vaccination. But then they're lured to go ahead and get the vaccination, and then they get their contact information and they're being charged. I mean, this is basically predatory practices, and that's what we're trying to get at. And it's interesting that we know that they're happening, setting up in mall areas. sometimes are more visible during the weekend where Monday to Friday, you know, the county officials are not available, right? And so it definitely is becoming a problem. So what we'll do on our end is making sure that we meet with your staff to really address this because it's getting worse. And all it's doing is confusing our stakeholders or constituents out there that are trying to get the vaccinations right for their well-being.
Thanks so much, Nina. And so we look forward to that conversation. And this is an area, anytime you see a natural disaster, or in this case, a pandemic, unfortunately, you will see bad actors who try to exploit that and prey on individuals. And so we just filed a lawsuit, for example, against a company that was, it was a COVID testing facility. They have locations all across our state, Eastern Washington, Western Washington, and they promised to obviously test your, to provide a test result for you within 48 hours. Well, it turned out we had employees from inside who sent us information, including photographs of garbage bags filled with COVID samples that were not being refrigerated, that were just sitting there in offices, that the staff was told to lie to people who called wondering what had happened to their test results. People were getting false negatives. So we filed a lawsuit against that company. It's a huge lawsuit. And in fact, we have another one on I can't give it away quite yet. I think it's being filed tomorrow on another issue related to COVID. So we're definitely active. Nina and my team would be happy to meet with you on that.
Okay, that'd be
or
great.
whoever's appropriate to go into more detail. And by the way, I do see in the chat, looks like somebody asked, my eyes are terrible. It looks like it says, what can we do to support your bill expanding healthcare coverage, I think. And so thanks for that question. You know, I should have the bill number in front of me. My apologies, I don't. But Tara Simmons is the sponsor. I think I have a member of my team who's on this call who maybe Josh can look up that bill number and type it in there. But it's Tara Simmons is the prime sponsor. It passed the House last week. It's going now to the Senate. So the focus would be over on the Senate. And so if folks support that bill, a hearing will no doubt be scheduled here in the next week or two. And at that hearing to have, if one supports that bill, to have that voice heard of how impactful this legislation could be would obviously be extremely important, because I do believe that this bill has the ability to be, you know, truly life-changing for a lot of folks.
Well, take a moment to translate a comment, probably more related to your last comment. For somebody who typed it in Spanish, I want to make sure that we don't miss their thoughts.
Thank you.
She said, with all my respect, I believe that we should make all efforts to make sure the guns are not close to either people under 21 or those who have suffer from any type of mentally illness. I also want you to remember that currently people are stuck at their homes, and young people are depressed, who are in the house playing a lot of games, and those games who are playing video games are very aggressive, and in many cases give increase the aggression in many of the viewers. So I just want also for you to think about how can we regulate the violence that our young people are seeing it in the media or in all different games who are available to them.
Yeah, thanks for translating that question for me. I appreciate it, or that really almost more of a comment. And look, as I mentioned it before, 13-year-old twins who, you know, want to spend more time in front of a computer doing video games than their dad and their mother want. So I can certainly appreciate that. I guess a couple thoughts. So number one, when it comes to regulating, say, video games or media, what you see on your TV, that is not my jurisdiction, unfortunately. I don't have control over that. That gets fairly complicated with sort of federal oversight and telecommunications laws that impact the entire country, right? Because those tend not to be state laws, but rather federal laws that govern that entire industry. And so I don't really have, honestly, any authority over that. So I can't speak from sort of direct experience in my office because I don't have control of that. I would encourage whoever was asking that question, I would encourage you to reach out to your federal representatives, your US senators, and your representative in Congress, because those are the individuals who write those laws and pass those laws that do impact what you see on video games, what you see on your TV, what your kids are seeing on video games, and what your kids see on TV. And so I would encourage you to do that. But I'm sympathetic as a parent who monitors very, very closely what our kids watch. I think we had a disagreement just last night on whether they wanted to watch a movie and we said no. So I really appreciate where you're coming from, but I would encourage you to reach out to your federal representatives on that issue.
Yeah, I see. Claudia, you're on mute, so
Yes.
I'm gonna mute you.
Yeah, I'm seeing a lot of comments
Oh,
coming through, so I'm
and Claudia, I
trying
do,
to.
oh, sorry, Claudia, I didn't mean to interrupt. I just was going to say, it looks like Josh from my team did type in the charity care bill, House Bill, and I think you mentioned this maybe, Claudia or Nina, someone did, House Bill 1616. Thank you, Josh, for doing that. That is the bill, and so that's the bill. If you're looking for the bill number, that is the one. I'm also seeing a question, by the way, about what are your thoughts on the language barriers our ESL parents face in Washington public schools? Many multicultural parents are denied access to their child's education. Have you worked on civil rights lawsuits in this area? So thank you so much for that question. A couple initial thoughts. So number one, happy to take that issue back to my civil rights team. One thing I just have to say is if we have investigations going on, we don't make those public until we file a lawsuit. So I just will start with that. But that is when I will ask my team about. Moreover, one thing I'll emphasize is that we do have a superintendent of public instruction, Superintendent Reichdahl, and so we have an elected official whose job it is to oversee our school system in Washington State. I'm your attorney, but he's the individual who oversees our schools and the policies and all the rest. So I would certainly encourage you to follow up with Superintendent Reichdahl about any concerns you have along those lines. That said, appreciate this issue and the importance of having all kids in our state having access to education, because that is the road for many children to opportunity in our society. And so I will, Josh is making a note for my team of that question, and I'll take that to my civil rights team and ask them about it. So thank you for raising that issue. I appreciate it.
I'm gonna look at something that we have in our question and answer. We have another community member in Spanish saying in Mason County, we have a lot of people who speak all different indigenous dialects. The Department of Health does not have any programs in any other language. And this is making an impact because the information is not reaching our communities. In Shelton, for example, the district used to have programs for indigenous language, and that's been taken away, and that's really affecting our families down there. Can you please consider this in terms of your priorities?
Sure. And Claudia, just make sure I was understanding that question correctly. That was the Department of Health was not providing that information?
Correct. Yes, Department of Health.
So,
correct.
So just so the person who asked that question knows, I don't, I'm not the Department of Health. That's a separate state agency that I don't have the power to tell them what to do. I'm not the governor, right? I can't, I'm not the head of the Department of Health. So I don't have any ability to tell them what to do. But what I can say is that, certainly in my office, as I mentioned before, we make our information available in multiple languages because it's so important. We have individuals who work, for example, in our different divisions who can speak with Washingtonians in different languages about the concerns that they have. So I take that responsibility very seriously. I'm happy to pass on that concern to the Department of Health, but I would frankly encourage whoever's asking that question to write to the Department of Health directly and write to the governor's office directly. That I just don't have, I just can't, I don't have the authority to tell them. I don't have the authority to tell them what to do. That's it. I appreciate the importance of that issue, and we'll certainly pass along the concern, but would encourage you to reach out directly to them and to the governor's office.
I think the probably Department of Health and the school district or whatever area the school is would be both places where they should, they are required to provide access in different languages.
And that's right. So I'm not an expert on those, obviously, but now our role with whether it's Department of Health, for example, or the superintendent, just to be clear, we give them legal advice if they ask for it. Just like a lawyer might give you legal advice about a personal matter or your business. Lawyers don't tell their clients what to do, right? The clients decide how they want to do things. And that's our relationship with both the Department of Health, and the superintendent. And so Clyde, I just want to say, thank you so much for all the questions. I just so appreciate it. And so Josh on my team, I'm not sure if we got to all of them, but he will make a note of any that if we didn't get to any of them. But just to wrap up, again, just to reemphasize, and it sounds like Nina will follow up on having some conversations, and Claudia, if folks want to do that, we do that all the time. My team's ready and able to have those conversations. And then you get the benefit of talking to folks in my office who are the experts in these different areas, right? We have a whole team in my office who are experts. And last thing I did want to mention is, we do have 13 offices around the state of Washington. So I happen to be in Seattle. I work primarily in Sound Olympia, but we have them in Spokane and Yakima and the Tri-Cities, and you get the idea, all around the state, Vancouver. And so we have a presence all around the state. We understand that our work impacts communities all across our state. And we want to make sure that we are doing a good job of communicating with folks all across the state to make sure that we're addressing those concerns, following up on those concerns, and we just really welcome any feedback at all. We just so much appreciate the partnership with Claudia, with you, Nina, the whole team. We really value it, and so looking forward to more conversations to come.
Yeah, I want to add, you can believe in the amount of things that are coming through. So I think that the role of an attorney general is a little bit foreign for communities of color, and especially for the Latino population. So anything that can be done in terms of education, right? They can be go out. So like you said, you call my agent, my office, and people will say, "Oh, I didn't know I could do that." So anything that we can do to educate our communities will empower our ability to respond to some of the, to share with you some of the concerns.
Absolutely. Most folks, I mean, hey, it's not intuitive what the Attorney General does, right? It's like some lawyer down there in Olympia. What does he do exactly? And so that is one thing we just really tried hard to do, is to get out there so folks understand where we can frankly be an advocate for the people. We are the people's law firm. We're the people's lawyer. And in doing that work, it's important that we're mindful of the issues and challenges that all communities face in our state. So again, just really appreciate the partnership. It's great to see so many of you, and hope to see you again soon in person.
Yes, thank you.
Thanks. Have a great day, everybody.
All right, well then we're going to close with our last presentation, very meaningful too, as well, to Latino Civic Alliance. But I thought, Anne, if you're on, if maybe we could, before we start our panel discussion, show the short 1.5 minute video, and then I will moderate the next and last panel on voting rights, or sorry, on the civil rights history in Washington State.
What do we do? Stand up, fight back! Latino families under the law. Stand up, fight back! Latino families under attack.
Wonderful to see our community show up, because these are the faces of our families, of those that contribute so much to our economy here in the state of Washington. These are the faces of parents who have sacrificed so much for their kids to get an education, to live the American dream that we all of our ancestors have come to this country for. The number of letters we have received from our children saying, please do not separate me from your family. Please let me get an education. Please let me continue to dream as everyone who's gone before me has had the opportunity to dream. Is remarkable. These families that are here today, the community that has shown up, 2,000 plus strong, came here because they have a message. They have a message that justice for some is justice for all. They have contributed taxes, contribute to our businesses. We have heard from our business communities who have said we can't do our work without them. Our tech companies, our hotel industries, our farm workers, they are a huge contributor to the economy of the state of Washington, and we welcome them here today, and we look forward to continuing to work to make Washington a safe state for everyone. Thank you.
Thank you. Thank you. So now I want to go ahead and move into our final presentation. Unfortunately, Dulce Gutierrez had to leave. She could not be with us. She did send her regrets. We will be posting a interview with her at a later time on our website and also on Facebook, and we'll notify the community that registered for the event if they're interested to see it. We have invited Dr. Gilberto Garcia. He is a professor with Central Washington University. Welcome, Dr. Garcia. Thank you for being here with us. Thank you. The presentation today is an education on the civil rights history of Washington State, the Chicano movement. And I think that the board of directors felt it was timely to really talk about the history to help for those of the generation today that may not know a lot of the work that our heroes and sheroes did back in the 1970s and 80s. And we thought it was important to bring him to present to us. So Dr. Garcia, if you would like to present a little bit about yourself and then a little bit, then move into your presentation. We do have some questions for you. So welcome and thank you so much. It's an honor that you're joining us today.
Well, thank you for inviting me. Well, I've been here since 1988. I started teaching at Eastern Washington University in the Chicano Education Program. And then in 2007, I moved to Central Washington University, where I started working in the Department of Political Science, but also was connected to the Latino Studies, Latin American Studies program that we started around the time when I was hired. So I'm still here at Central and working with students, mentoring students to hopefully go to grad school, and also trying to connect them with the community. So my topic, and as we're talking about it, I kept thinking, what would be like, the way to present some of the material? I guess you said like 20 minutes, is that or less?
Yes, 20 minutes, and then we have a few questions.
Yeah. So one of the things that I written, actually, I wrote probably one of the first chapters, in Chicano politics in the Northwest in 1995 when I was teaching at Eastern, and I've been wanting to go back and revise it. Then I published another article recently in the Oxford Encyclopedia in Contemporary Politics and Law and Social Movements, and dealing with the Northwest. And so I'm still kind of working on that kind of research. So I thought I'd share more like a brief historical overview of what I think is important for us to think about, as we become politically active in our communities. So that's kind of more or less the focus. So I'm going to present sort of two aspects of this quest, right, of political activism. So I kind of titled mine "Political Empowerment in the Latino Community in the Northwest: A Historical Overview." One of the things that I learned, because I came from California. I lived in California most of my life, and then when I was hired to come to the Northwest in 1988. I was an outsider. I didn't know anybody. I didn't know the community. So it was the students who invited me to go visit their relatives in Othello, in Warden, in Yakima, in different places. And that's when I started to pay attention to the political life of those communities. And so obviously the first thing that I learned, right, is that we as a community, we are relatively young. We don't have the historical experience of the communities in California, Texas, New Mexico, or Colorado, Arizona, right? And so what I found out, because we came into the region, obviously as immigrants, and then later on some were like U.S. citizens who were migrating into the Northwest. But most of the early political organizations tended to be, a reflection of that community. So like if you looked at all the early groups, a lot of them, because of their immigrant background, right, tended to be more like, sort of like what we call patriotic organizations who organize like holidays for the 6 de septiembre, 5 de mayo. So we really didn't have political organizations in the region. And that was the case, throughout, all the way to the 60s, because, even the organizations that we sort of associate with those early years in the Southwest, they made some inroads, but they never really withstood in the time here in the region. And I'm talking about organizations like LULAC, MAPA, that were part of that, the Southwest experience. Even though they emerged, they were not here for a long time. And so it's not really until really the early 60s, late 60s, that we begin to see now the, kind of like the maturation of the community as we became more established. People began to stay here and then go back to Texas. They not go back to their places of origin. They began to think more like, we're staying here, so what are we going to do about the problems, right? And so one of the lessons that I learned, you know, as an outsider when I came to Washington, and I started to talk to people and read about, you know, the communities. You know, one organization that really stood out, you know, and I kept saying, wow, this is the kind of stuff that we need here. And this is an organization that emerged in the late 60s in the Yakima area. It was called the Mexican American Federation. And I really liked, you know, the kind of work they were doing, because they divided themselves into regions so that they actually would have like a chapter representing the Puget Sound area, one for the Yakima area, one for the Spokane, sort of like in the Columbia Basin area. And this organization, you know, was made up of 155 individuals. And each region kind of like focused on different issues. Puget Sound dealt more with employment and placement, you know, issues. Yakima actually dealt with voter registration and civic education. And they dealt, you know, with trying to elect people into office very early on in the 60s, right? They also challenged like an English literacy requirement and demanded more Spanish-speaking registrars, right? So this organization really impressed me as far as like how they wanted to change things. And I saw them basically as a grassroots organization. And so that's kind of what I wanted to identify, this historical evolution of our organizations. And there were other groups, you know, that also were connected to the Chicano movement, especially the student movement. For example, out of the University of Washington, we had students who had entered the university, and a lot of them began to obviously organize themselves to actually come back to the community. And again, those early organizations had a very similar orientation like the MAF. They were grassroots oriented. For example, Escuelita, they were established in Granger, Washington, basically was reaching out to, you know, students in those communities, and they were teaching them in a way like Chicano studies, right? Like history, culture. And then another organization called El Año del Mexicano is also part of the same era, very grassroots oriented. You know, they also got involved in political activism. And so one of the things that I found like as a learning experience studying, you know, this part of the region in the Northwest is how these organizations were emerging out of the communities, right? And we saw it in other communities, because I also did like a study about Othello. And so out of the Othello area, Moses Lake, Quincy, we also saw the emergence of other, like what I call grassroots organizations, you know, that were made up of people who were part of the migrant movements, you know, from Texas to the state of Washington. And a lot of them were like obviously involved in services for migrant workers, but also were involved in voter registration. You know, for example, the Othello Spanish American Club that was in the early 60s, early 60s, was involved in this kind of a political activism. Later on in Quincy, we also had another organization that was called the Progressive League of Mexican Americans, who wanted more access to government services. And so why am I mentioning these groups, right, briefly, right, is that even though we're a young community, we already were beginning to make inroads, you know, in trying to organize the community from the bottom, right? So I kind of like, I'm a political scientist, and the way that I analyze, you know, the political evolution of our communities is that we sort of see the influence of top to bottom, and then from the down to top, right? Kind of like, you know, looking at the grassroots. And I seen that historical development, and I'll talk more about that when I talk about the other groups. But the Chicano movement played a central role. You know, it's interesting, you know, to see how students who were originally from the Yakima Valley and entered the University of Washington eventually organized, you know, organizations like MASA, which is, they're the early precursors of Mecha, and UMAS, which eventually became Mecha, right? And so these organizations would emerge in UW, Yakima Valley Community College, and Washington State University. In my research, you know, I actually left out Central Washington University, but also Central was involved in the early 70s with the same kind of a, you know, organizational direction, right? Eastern was involved, but much later, you know, until 1977. But what I wanted to point out, right, is how these organizations who were like student-led went back to the communities, right? And got involved in trying to reach out to, to their communities in Yakima or in the Columbia Basin. So this kind of activism, I really find that missing, this kind of a grassroots organizing. And it's part of the era, right? So I understand that's part of the era, but it left like a lesson, like a historical lesson that we can learn from. And we can see it from the activities that Mecha, was involved with, right? In challenging, discrimination, racism, promoting, for example, the hiring of more faculty in those universities and community colleges. And so that had an impact, locally, with the organizations. And that happened, in Washington State, as well as in UW, with the student movement having a major impact in those, universities. And, in terms of, like, so that's kind of like what I consider like the down to top, sort of like organizations. But then also like around the same time, we saw the emergence of another organization that would become significant throughout the Pacific Northwest. And this is the Commissions on Hispanic Affairs, right? That would become like a force within the various states, Washington, Oregon, and Idaho. Now, what would happen, right, is that these organizations, emerge, actually some of them, were called Chicano Affairs, and eventually they changed back, to Hispanic Affairs. But what actually would happen, with these organizations, right? They actually were not bad, because they explored, for example, if you look at the Oregon Commission on Hispanic Affairs, they wanted to explore like cases of police harassment, health services for migrants. They wanted to push for affirmative action. They actually organized like regional conferences or regional hearings, dealt with immigration law reform. So, they were not bad, right? They were like actually, but in terms of as an organization for the communities, it was limited, at least that's my position. And for example, also with the Washington Commission on Hispanic Affairs, they also emerged just like in Oregon. And actually, one of the things as I was doing the research on Washington, I find, like there is an interesting, situation that within the Washington Commission, initially it was called Mexican American Affairs, right? And most of the activists were like from the Farm Workers Union, from Granger, from Yakima, and they were actually, I would want to call them like the progressives, kind of like the radicals. And so as the commission was established in Washington, they played a very major role in promoting like an activist role from the state. And but obviously they would clash. So then like within the Washington State Commission on Hispanic Affairs, you saw like two groups, the establishment and the radicals, right? And this included, probably some of you know them, Ricardo Sanchez, and those who were involved in Granger, Washington with the Farm Workers Union, right? And they would clash in the meetings, right? I mean, with the conservatives, right? So you had like the establishment, and who were the establishment? Well, they were like, basically the growers, right? Kind of like the local growers supported by the Republican Party. And so within the commission, we saw that clash for years until obviously it changed, right? Now they still promoted similar movements, like in Oregon. And so I'm not too overly critical about these groups, but I am partially, okay? I want to share my bias. And then also the other one is in Idaho. So that one is also interesting because, like in my encounter with the Latino communities, predominantly of Mexican origin in the Northwest, right? The Idaho community, that one was really surprising. It's obviously more conservative, and in some, I want to say like, at least, during the years when I visited Idaho, when I was doing the research, fairly racist, state, if you're from Idaho, I'm sorry to hurt your feelings, but that was my experience. And I always tell stories about the students when I went to Idaho, but still, within Idaho, there also was a group of people that say, hey, we need to like promote the interests of our community. And you find them, also doing the same stuff, so when I looked at the Idaho Commission, they had more problems in establishing it, right? Like they told the state, governor, hey, we need a commission. And they got involved in a battle, discussing, arguing. Eventually, it was like approved, by the state. But they were facing really a difficult situation in Idaho. I don't want to say Washington, Oregon were like nice states, but in comparison to Idaho, I guess they were much better, in terms of the relationship with the Latino community. But still, if you look at the Idaho one, they wanted to look at the same kind of issues like in Oregon, in Washington, in terms of disseminating information, gathering information, conducting hearings, and trying to get the community more informed, and especially more connected with state department and agencies, right? So they were trying to move the community to at least make that connection. And so this kind of experiences, both the early ones, like I mentioned, the Mexican American Federation, and you could even include the Farm Workers Union, and then what would become the Commission on Hispanic Affairs. They would evolve different paths, okay? So then, when I wrote the first chapter on the Northwest, I was actually very critical of the Commission on Hispanic Affairs. And so one of the things that I felt that we needed to look at these organizations, really closely, is that we needed, like from my perspective as a political scientist and somebody who is like a product of the Chicano movement, I felt that we needed, and we need actually, so like we still need like grassroots organizations, who can challenge and demand the state right for the advancement of policies affecting the Latino community. And when I say grassroots, I mean organizations that are like independent and represent like local communities. See, for me, the commission is a statewide organization, right? Then that's like a problem, when you begin to pay attention to who is part of the commission, right? And so then you begin to find out, right, that they are like basically representatives of the state, right? Of the state apparatus, right? And many times they are like affected, by the appointment to these commissions, right? And so then you have that clash, kind of like in Washington, between the establishment and the radicals, right? And so I felt like, that even though the commissions on Hispanic Affairs are good, they do certain things that are positive, but that they are limited because of their connection as appointees or people that are connected to the governor or the legislature, right? Because most of them were like connected. And so then, one of the things that I sort of promote is more of the grassroots organizations, and there are some examples, that I began to notice. For example, look at the reemergence of LULAC here in Washington. And I was kind of shocked because LULAC historically, has a very conservative position, right, in our communities. And so within Washington, they reemerge. But what's positive about the LULAC experiment is that they are like emerging in local communities, because you have like a chapter in Pasco, a chapter in Yakima, and I think a chapter in Vancouver. And so those are like, what I consider like sort of like attempts to place independent organizations. And consequently, we need more of that, that's
Dr.
my
Garcia.
opinion, right?
Dr. Garcia, because of time,
Yeah.
I just wanted to jump in and let you know that there are other organizations like LCA that's grassroots organization where we invite you, and other organizations out there that are doing incredible work, and also included, you mentioned LULAC. But in respect to the Commission on Hispanic Affairs, I think that since they're not with us and you mentioned them, yes, they are appointees from the, governor, but what I have seen over the years, the last, 7-8 years, that there's been a big change in how the appointments are, and that the commissioners really that are appointed, regardless of what their limitations are, working on what what they can and cannot do, right? And been transparent about that with grassroots organizations like ours and LCA. And I think that was really important. I'm not sure that happened before, back in the day, but I can tell you that now, what I appreciate is with the leadership, Dr. Baca now is the chair of the Commission on Hispanic Affairs, and they'll know that there were limitations of what they could do. But you share such great history, and and I think that I saw some background on you with about Metro 2 is another organization. So there's all this movement, and Jimmy's going to ask you some questions to close us up because I
Sure,
think
yeah.
it ties into
Yeah.
that. But I wanted to thank you so much for that historical context. Jimmy?
Muchas gracias, doctor. I was born in Preston, Idaho, so and raised in Eastern Washington as a farm worker. So
Okay,
I
you're
understand.
familiar.
So they call me sometimes a radical in politics. Pero mira, first of all, fascinating. I love the information that you were providing because I always say it's like the forgotten story, right? Why did we get here? And how is it that today I can be a council member, and why we have Latino senators and House representatives? And me alegra how you were able to, because it takes me back and I kind of start, let's just say that I was one of the ones that went against the commission, had that big old protest back in I think it was 1999. Pero mira, te tengo esta preguntita. Do you have an opinion on how the past generations of the 1960s, 1970s, and 1980s compared to the current generation regarding to activism, and what is the difference, and how is the current generation using their political voice?
Right. Well, one of the things that I was adding, like in my summary, I also have to recognize, like for example, how our communities have evolved, in terms of like their backgrounds. If you look at the background of the activists in the Mexican American Federation, I mean, they were really grassroots. I mean, they were, like you said, farm workers. I mean, in fact, I remember talking to Ricardo and some of the people in Yakima, and how they used to get into fights with the governor, right? And would demand, like, you better pay attention to our issues and so on and so on. And but then over time, what I've seen, and you can tell by the membership of the commissions, and even in this organization, in fact, I want to do a study about this organization, because it is another example, of people who in a way, evolve, what you're saying, like people, like, obviously when I was looking at the background of the members of this organization, yeah, they're different, man. They got education, they got like master's degrees. They're like, obviously we need that, we need the skills that people have gained. But I guess, I want to go back to Nina, like, I still think there's something missing. We need like more emotion, more like willingness to confront these institutions and not be so, I don't know, like status quo, kind of like.
I hear you. Yep.
That's my criticism. So, but I do see the, the improvement, right? I mean, not improvement, but the changes in the new generation, because, like, we are seeing more individuals, like at Central, I'm seeing a lot of students applying for law school, students going to graduate school who want to, like, complete their degrees. And those are the ones that are going back to our community, right? But they also need to hear like this story, like in my classes, so they can see their connections with their skills, their knowledge, and how they're gonna bring about change, right? So in other words, like in my classes, I promote activism that is gonna bring about change. People who are getting education should apply that education to bring about change. Not, oh, I'm gonna become like this successful person, and I don't care what happens in the community, right? So I think your point, right, of what you're saying about your background, yeah, we've seen it more, and I think that's good. I think we just need to see more of a connection with our communities.
Yes.
See, that's why, and I'm critical of the commission. I know.
No, I hear you, Dr. Garcia. I think what I hear you say, though, for us, for Latino Civic Alliance, we're fire, and we call things out when we need to, right? We've been known to that, and we have to. And I think our younger generation, that's what we were curious if you see that in your classes, and you talk to the students. What are you seeing in them compared to the generation before?
Well, I mean, just to give you an idea, like, you start to get this illusion for a while. I'm the co-advisor to Mecha at Central. And almost every year that I've been going to the meetings, they are still like very large, like 25, 30 students. And I'm going like, wow. So the spirit of the 60s hasn't disappeared, right? And obviously I'm older, right? So then I see these young kids, oh my God, they're like little children, But then, where they are similar to me when I was a mechista, right, is their spirit. They want to be involved. And you can see their enthusiasm, and I think, see, that, I guess in a way, that's what I wish that could be transferred, into the organizations, so that you could be more I guess, proactive or activist, and maybe minimize, this, this movement that I've seen in a lot of, I'm not saying all of the activists, right? Where they just become too status quo, and they don't want to question the system. Why? Because they want to advance their careers. That happens in my school, that happens outside, but still, I appreciate your comment, about our communities and how they're changing. So I do see benefits, positive aspects of how our communities have improved, their position, and
I think though, Dr. Garcia, having perspectives like yours though, that are, objective, that done research, to share with us, because that's what we wanted you to come and do, because this is knowledge. Knowledge is power. And so, thank you. Jimmy, I know I jumped in here, but you have one more. I think we have one more for one question more.
So here's another question. I'm excited, actually. I look forward to maybe in the future having these transparent conversations, porque la realidad, el amor al pueblo, educación y acción es lo que se necesita. Pero here's the other one. It appears that in history that the labor rights, especially from farmers' activism, played an important role in the civil rights movement in our state. Can you share more insight on how the efforts in the past can make a difference ahora today?
I think he touched on it a little bit, Dr. Garcia, but maybe you could elaborate.
No, that's a good question. It's an area that, one of the things that I did want to point out is that since I've been here since '88, but you know what, our community has changed a lot. So for example, I always tell people look, in spite of what you say about Yakima, it's where all Mexicanos live, right? I say, you know what, you're mistaken. There are now more people on the west side in the Seattle Puget Sound, and it's not, people say, oh, it's a Hispanic, Latino, there are other Latinos, Hispanic, yes. But you know what? The majority still are Mexican origin, right? In other words, in fact, we have more Mexicanos on the west side than on the eastern part of Washington. And people get surprised. And not only that, but they're different, right? And I'm not saying they're a bit superior. They're just you can see, this urban orientation now for those who live in Seattle, and they have a different experience, right? And but it doesn't mean that the farm worker experience has disappeared, right? We still got issues going on in Yakima, in the Columbia Basin, that we need to address. And so consequently, we still need, the United Farm Workers Union or some kind of farm worker organization. But we also have to keep in mind that we also have to remember that now we have seen a more urbanized community, more city-bound community with different issues and different problems, And so I don't know if I answered your question, but
yes, you did. You did.
Gracias, doctor. I think you hit the nail on the head, because my mom and dad son de Guatemala. They came to this country in 1974 undocumented, right? And so I had to learn ser mexicano. Entonces ahora como los chiles, como tacos, pero toda mi familia es centroamericana. So, el sabor está cambiando in Washington, and you can never forget la historia para hacer el futuro. So we really thank you with your commitment to, higher education. Very important. Pero es como le digo a mi hija, she's going to UW Foster Business School. Nunca hay que olvidarnos de donde venimos.
Correct. Yeah, that's it. My message to the students.
All right. Well, thank you, Dr. Garcia. It was a pleasure for you joining us, and we're definitely going to stay in touch with you.
Yeah.
Thank you so much.
Thank you for inviting me.
You bet. And now we'll close with Vice Chair Jimmy Mata.
Muchas gracias. It's my pleasure to close this meeting here today. I have a couple of words that I've prepared. It's because if you know me, I can go on and on, right? Chair? Okay, today marked yet another historical moment of empowerment in our community. Today we have demanded justice and equitable treatment, ranging from COVID pandemic relief to economic impacts to small business and social emotional learning programs that was shared today by Latino Civic Alliance. Every single person in attendance today has taken part in doing the work to create a future where our Latina communities can flourish and harvest the fruit of their hard work and labor. To the presenters, con computers. To every presenter, speaker, politician, and guest here today, We thank you from the bottom of our heart, and we urge you to harness everything you have learned today to continue making a meaningful change in nuestra comunidades. These past 2 years haven't been easy. The ongoing pandemic has and continues to target the political and social inequities in our communities who they face every day. We will need to work together as we begin to mend the ongoing disparities COVID has uncovered and continues to worsen. As leaders, we can and must do more to provide the information and resources our diverse community needs and for which they are crying out for. Our Latino and Latina families and communities deserve more than what we have received. This is all I ask, is performance, not promises, is what we need today. Como lo has dicho, el amor al pueblo, the love for community, education, educación, action, acción, is what we need, porque sí se puede. Muchas gracias, and we see you in 2023. Let's get some work done. We're coming through election. Let's get the elected officials that respect, support us, our children, nuestros veteranos de guerra, nuestros veteranos que están de edad. Ya es hora que despertemos. Let's register to vote. Let's vote, and let's go take what's ours. Muchas gracias.
Thank you, Jimmy. And Claudia, I just want to say to everyone that we got an update of all the legislative appointments that have happened. We actually had over 100 legislative appointments, and we'll get the feedback from those meetings with legislators and share them. Again, thank you, everyone.